professionals and our professionals here today be able to maybe comment on some of the things, and then have you be able to ask questions, and then we'll start the next section. So it is my great pleasure tonight to introduce to you some special guests. We have Dr. Neil Woodbury here, Vice President of Research at Knowledge Enterprise, Chief Science and Technology Officer, and Professor of School of Molecular Sciences at Arizona State University. And of course, our very own Dr. Amy Jo Overland, again, primary care sports medicine physician. She does all sorts of things with the head team positions for multiple teams, especially here at Tempe Union, and of course works with Banner. And we're pleased to have both of them, and they'll be able to share some things maybe in regards to the metrics and indicators and vaccinations, and even an idea of what would be wise for us to do as we continue our process of getting back in person. So what you see here is we're going to go through the metrics a little bit. In Maricopa County, as you can see, we do finally start seeing the downward trend of the second wave here, and we're moving on to about 720 to 100,000. Mind you, tomorrow these numbers will change, and we believe that they will further go down as well. Our benchmark 2, which is percent positivity, is at 19.6%, down 3%. And then also our COVID-like illnesses in the hospital for Maricopa County went down to about 16.4. As we look at the district metrics, and I want to remind people that the district metrics are not just what they think of, the few Tempe zip codes, but we actually take these numbers from 19 main zip codes in Tempe of who we pull from. And so when we get to some of the predictors, I'll talk a little bit more about that, but you also see the same trend going here. Percent positivity went down a little bit, cases per 100,000 went down as well, and of course COVID-like illnesses in the hospitals down to 12.5%. I'll show you the schools individually, and Tempe High here is made up of 6 zip codes. Of course, some of those zip codes in Tempe, some of those zip codes in Phoenix area, baseline corridor and whatnot. And again, you'll start seeing the same trend in each area. So again, about a quarter or more going down in cases per 100,000. Percent positivity dropped about 3 or so, 2.5 to 3. And then COVID-like illnesses, you'll see are 12.5% across the board. McClintock, very similar in nature. Again, made up of 7 different zip codes. Marcos de Niza, once again, same thing. Our families in Guadalupe, Tempe, and then also the baseline corridor. Corona has 8 zip codes. And once again, cases per 100,000 going down about 0.25%. About a quarter, I should say, about 25%. Also percent positivity down, same as Mountain Point and Desert Vista, also made up of 4 different zip codes. Collectively, as we spoke of, 19 different zip codes in our area, and how we do that is we take an N number, and that N number is 40 or more, and we count those in our students. And of course, Compadre, following the same trends. What we see here is that comparison curve of the first wave versus the second wave. And it took us about 8 weeks in the first wave to start going back down. As you can see, it took us about 15 weeks in the second wave to go back down. And there's a little predictor arrow that we believe that will continue to be the trend when it comes to this current wave. When we look at Arizona positivity, I believe it was somewhere close to 16% today or so, but we believe that will continue to go down. The interesting thing about this, and maybe our guest could speak a little bit about this, we believe that these numbers may stay up a little bit, but we are also seeing that the amount of testing is going lower as well. And so not everybody is so anxious about it, going out and getting as many tests, because they have maybe little sniffles or things like that again. So I do think human behavior, we're getting a little bit laxed again, which may keep that those people that really feel they may have COVID are going to get tested by other ones are just not really too worried about it much. And so our rate of reproduction, our R0 number, you see that is actually below the blue line, and that blue line is at 1. And so anything above the 1 markers, that would be an increase in our rate of reproduction when it comes to COVID. You see here for several weeks, we've been below that R0 number, below 1. And so therefore, that's the decrease that we see in our metrics today. As far as COVID-like patients in the hospitals and ventilation, of course, you see a downward trend going there as well and continue to do so. And then, of course, cases by the week. And we saw that pinnacle happen around the first part of January, that big part where holiday season and all the fun and festivities were going on. Continue to go down by the month as well. And then, of course, the number of people that we talked about tested over time. You see, though, it went high, is starting to go down low and will probably continue to go lower. This is another angle that we could look at, and you'll see that first hill there, that first bump there. That was wave number 1, and the second one more to the right, that's wave number 2. The interesting factor about this is all confirmed probable COVID-19 cases. And when you look at the age groups of this makeup, you'll notice that the 0 to 19 years old make up about 16% of the positive cases. When you look at 20 to 44, they're much higher at 46, 45 to 64, that's 27%. Those two groups take about 73%. As we know, 65 and older, only about 12%. So I want you to consider 0 to 19, pretty low percentage. I know there will be some questions about that, probably about some pediatric cases that I believe our doctors or special guests could be able to answer for some of us as well. So we'll go ahead and let Dr. Overland and Dr. Woodbury maybe make some comments if they have anything on the metrics that they saw today, and then we'll open that up for questions to the governing board. Dr. Overland, do you have any comments or thoughts?
Sure, I can go first. I didn't know if Dr. Woodburn wanted to go first. So I agree that overall we should continue to trend downwards. I think there's a couple aspects we need to consider. One is we have notably spiked every time after a holiday throughout this pandemic. And obviously we have spring break coming up, which for our student families is a holiday. So we can expect increased travel and potential increased exposure over that time. So though I do think overall we're going to trend downwards, we could see a additional small spike during the mid-March area when we're trying to get into our fourth quarter. So that's going to be a challenge for us. We'll see if anything happens with Super Bowl, with all the Super Bowl parties, if people are good or not. But I think overall we should continue to trend downwards in a positive manner. I do know Banner University hospitals, our ventilator use from COVID-19 patients is continuing to trend downwards on a steady state. Our numbers inpatient continue to trend downwards. So from a Banner system perspective, as well as Banner University where I'm hubbed, we are following those same exact trends. The other thing I would like to point out, though, with the definitely low percentage in our age group, which we're dealing with all day, asymptomatic youth spreaders is absolutely a real thing. We've had plenty of kids just through this experience within our district test positive without symptoms, and they're getting tested because mom had symptoms or cousin had symptoms, they were exposed and they were getting a test. And the question is, you know, mom had symptoms, kid also tested positive. Did mom give it to the kid, or did kid actually bring home and give it to mom? And mom was the one who was symptomatic. So chicken before the egg. And so there is, parents that aren't leaving the house that are getting it, that are certainly getting it from kids as the inoculators. So we have that component. And then the last component, just to keep in our heads as we talk about this, and we'll get into vaccines and stuff, is the Pfizer vaccine is only FDA approved for 16 and older, and the Moderna vaccine is only approved for 18 and older. So a large portion of our kids will not be eligible to be vaccinated. So just that's another thing going forward we just want to keep in our back of our heads. And that's all I have for this part. Dr. Woodburn.
Sure, thanks. I agree very much with what Dr. Oberlin said. I think that the trend will be down for a period of time. I think there's a lot of uncertainty about exactly what will happen in the months ahead after that, and we'll have to be monitoring a number of things. I think you're all aware that there are some, that the virus itself is evolving over time, and we can talk more about that later if you want to. And there are some uncertainties associated with that. We're obviously watching that very carefully and seeing how that proceeds. But I think that you can expect for the next month or two that it will likely trend downward. Also, Dr. Oberlin's absolutely correct that the primary mechanism by which we see the virus transmission is via social interaction. It's generally not structured environments in which this is happening. It's unstructured environments. It's normal human activity that tends to spread the virus, unfortunately. And the tricky part of that is it's often the case, whether you're talking about a youth or anyone, that the spread occurs before there's any symptoms. So it's difficult from that point of view to deal with it in sort of the way we might deal with other viruses that spread after symptom occurs. But right now, I would say that the trends are in the right direction. If you take the precautions, you will decrease the spread. We are in a situation where R is less than 1. We want to keep it there as much as we can.
Thank you both, Dr. Oberlin and Dr. Woodbury. And we will be sharing that. It is about human behavior, things like were spoken of, Super Bowl, not having those parties, reconsidering going away, so we can get our kids back in person into school. They're going to be so important. So we'll open it up for questions.
All right, so at this time, board members, because of limitation on time, we're going to limit to 1 comment, 1 question, no compounded questions, and 1 follow-up. And then if we have time, we'll circle back. If not, then we'll continue moving. So we'll start, I believe, Ms. Hodge raised her hand. Ms. Hodge? Ms. Hodge, you're muted.
Thank you. My question is, when you say asymptomatic, how many percentage of kids do you know that you think that could be higher with the 16% that goes through the COVID and never know they have it? Does anybody have any ideas on that?
Dr. Oberlin, go ahead.
Oh, okay. I was going to say that we don't have great data because we're not testing everybody who's asymptomatic. It's only because there's already somebody else in the family sick. So I know we're picking up and I can't give you percentage, but I can just from experience, I can tell you we're picking up in our district a substantial number of kids who test positive that never display symptoms. But we don't know, because we're not doing blanket testing like they are, say, for collegiate athletics or in professional on a daily basis. We don't know when that seroconversion is happening, and we don't know true numbers because we're just not blankly screening the population. So I'm sorry, I don't have great data from my end, at least.
It's okay. It's okay. I just want to make sure that's out there, that it may be more some cases and we're not just seeing them because of the asymptomatic. Thank you.
Dr. Woodbury, did you have a comment?
Well, what we've done, fortunately, because of the way we can deal with our community at ASU, we can do it among that age group. That's not to say that's necessarily the same as the age groups we're talking about in K through 12, but we have data for that age group. What we do is we do randomized testing with that age group. And I'll warn you that although we call it randomized testing, the sampling isn't perfect. Sampling populations is a tricky business, and trying to get all 18 and 19-year-olds to come in when they're called is a tricky thing. But I'd say we do a reasonable job of getting a randomized sample, and that allows us to get some idea of what's going on. The vast majority of our students have little or no symptoms. So the vast majority of the positives that we see have little or no symptoms at all. And you know, I mean, that's in some sense the blessing of, if there is a blessing to this disease, unlike, for example, the 1968 flu, it is that it is not generally a big adverse effect to our children. And that's, you know, that's something we're all very thankful for. But on the other hand, it complicates it because we can't tell how many of them have it without doing this sort of mass testing. They, generally speaking, don't get sick, or at least not significantly ill.
Thank you, sir.
All right, board members, any other questions at this time? Member James?
Yeah, I just wanted to follow up along similar lines for what Board Member Hodge was talking about with the pediatric cases and the number of unknowns that we would have. We also know that there's an increase in pediatric cases, and we're seeing the UK strain showing up more, and know that that does affect children more. So do you have any data about how we're testing for that strain? Or suggestions when it comes to returning in person for any, you know, testing that we could, you know, encourage. I don't think we can mandate it. I would love to be able to have some sort of robust testing in our schools. But yeah, just any suggestions along those lines to stay on top of cases in our community in the pediatric spread that we are hoping we don't see.
So with regard to the various different strains, almost all of them have, this is from a genetics point of view, is very interesting. We see a lot of convergent evolution, which just basically means the same mutations keep popping up in different parts of the world, in different combinations, but basically we keep seeing some of the same mutations pop up. The test that we're doing, the saliva test that we're doing at ASU, it depends on which test we're talking about, but for that test, it tests for 3 genes in the virus. And 2 of those genes, in all of the strains that we have been seeing coming up in the world, we would see as positives. And the other one, which is the spike protein, is the one that gets affected most by the mutations that we're seeing, and that one will come up negative. And so we call these S gene dropouts. And so we monitor specifically for S gene dropouts. Now, not all S gene dropouts are the UK strain or the Brazil strain or the you know, South African strain. They can be, for other reasons, completely different than that. And so we monitor those, and we've been sequencing those. And that's where the first 3 Arizona cases came up, is that we sequenced some of those S gene dropouts and found those cases. So it's there. It is not the prevalent situation right now, and I'm watching that daily in terms of what is happening in the population that we look at, which is the ADHS testing we do around the state. So far, it's there, definitely there, but it's not the dominant strain.
Thank you, sir.
Vice President Barraza?
Yes, first off, thank you everyone for the presentation and all the hard work everyone put into it. There's a lot of slides, so I won't keep everyone held up with lengthy questions. I guess to just kind of keep it short, we're not seeing the testing numbers, or at least the sample size that we need to be able to make decisions in terms of positive rates in our youth. Should we be looking at the positivity rates of our staff members and, family members in our community as guides? I'm just trying to figure out what compass we can utilize if we're going towards an opening 5-day plan. At some point, we're going to have to consider these things. So, and should we be testing staff? Really, is that what we should be focused on? Thank you.
We've started some pilot programs with districts to do random staff testing. Thus far, there hasn't been many takers. So we haven't seen a big turnout for those situations. We actually have had special, situations where they would sign up ahead of time and we'd make sure we get them in the queue and everything else. But that hasn't been popular, and thus far there's been no talk about mandating it. So from my point of view, that's sort of where it is. We're happy to try and help if there's something we can do.
I would say from a cost standpoint, it's a difficult endeavor. I am the head team physician for Phoenix Mercury, and my group is also the head team docs for the Phoenix Suns. So we're involved in daily mandatory testing, and the amount of money going behind a program like that is not cheap, so I don't know that for a public school district to have to inherit that cost to benefit ratio, if it makes sense from even just a fiscal standpoint. Certainly a public health standpoint, it would probably give us a lot of good information, but I'm not sure from a fiscal standpoint it truly makes sense considering the district and what you guys have to put money towards.
Well, what I will say is at the moment, the state is footing the bill. So our sites are available and they are free. So you don't have to pay for them right now. Now, whether the state will always decide to foot the bill, I don't know. That's another question. But at the moment they are. And you've got, what, 40,000 teachers in the state? Something, or 40,000 staff members in the state? So if you did 25% a week, or that might be a little hard, maybe 15% a week, it probably could, the sites we have could probably handle that. And you'd get some representative sample. But in order to get a really representative sample, you'd probably have to make it mandatory.
Thank you. Member Montero.
Thank you. And I first want to thank everyone for all their hard work behind this presentation. And just kind of adding on to what my fellow board members said previously, looking at these pediatric cases, I think this is something we really need to look more into, given that a large portion of our student population is not going to be eligible for the vaccine. And so my question is just kind of looking at the 16% that you presented earlier, do we have any data to look at the testing numbers for this group relative to other groups? Is this 0 to 19 age group getting tested at a similar rate, or are they not? Because I know there may be barriers to students this age, whether or not knowing where to get tested, how to sign up to get tested, et cetera. Do we have any of those numbers to kind of get an idea of where that's at?
Dr. Woodbury or Dr. Overland, do you have that answer for them? We could always get that if we don't.
I think I don't have an answer off the top of my head. I was just trying to think whether I had something I could quickly put my hands on. That data is out there from the state, but I don't. I'd have to go into my computer files to get it, but I could provide that data to Mr. McDonald.
Yeah, Mr. Montero, we'll go ahead and grab that data for you, and we'll get that to the governing board as soon as we can.
Perfect. Thank you.
All right, thank you. In the interest of time, we will keep going. Mr. McDonald.
Thank you, President Garcia. So we're going to move on, and an idea of this safely returning to the in-person instruction. You'll remember back on August 26th, I did a study session then, and we talked a little bit about the benchmarks and, of course, two key components. And those two key components were the quality of the district school mitigation plan, right? Or the how are we going to do this mitigation plan? And then the metrics, or the degree of community spread. And both of these components are equally as important in determining the safe reopening. And then we believe there's a third component that we'll talk about today after this, which will be about vaccinations. And how does that help support the reopening in-person instruction as well. So again, component number one, health mitigation plan. We have a very robust health mitigation plans been posted to the district website. Now, again, remember the quality of the mitigation plan. I know Dr. Oberlin sent this to me in an email today. Will be dependent upon each of us. We have it, and if it's not used or used correctly by everyone every day, then it's not going to be as conducive to one that, you know, could be. And we want to make sure that our health mitigation plan, and we've done a lot of training on videos and whatnot for both students and staff. We will do this again, but we want to make sure that everybody, including the community, is following the mitigation plan even when they're outside in their community. Because what we are seeing is that the active cases that are going on are typically coming from the outside into the inside. Very rarely do we have a transmission through our students to another student. We always seem to find there's a connection to being at a party, having an overnight sleepover, going to a game, Christmas, those type of things that occurred. So parents and students and staff, all of our behaviors matter. I wanted to make sure we spoke to that. Component number two is about level of community spread. And so the when of reopening safely, and we're going to go ahead and talk about the thresholds, the benchmarks, the indicators that we go ahead and look at. Now, these are the levels that the CDC defines, and the Arizona Department of Health Services define: minimal community spread, evidence or isolated cases of limited community transmission, moderate community spread, and substantial community spread, a large scale. So when we look at this with the comparison of the Arizona Department of Health Services and the CDC factors, and we look at this, the top one where the benchmarks are minimal, moderate, and substantial, and the recommended delivery model will be those following it. The one on the bottom, the indicators, is the CDC risk factors. And what I did is I tried to clump it a little bit so that when we look at numbers, we'll be able to see the two different of how they fall into and why that we believe that our prediction of numbers, we will get to a moderate state to be able to have in-person instruction. So when we look currently at the Arizona Department of Health Services benchmarks, the risk factors show as this. Yes, cases are greater than 100 per 100,000. Yes, percent positivity is greater than 10% currently. And yes, COVID-like illnesses, we know we just saw 12.5%, greater than 10%. We believe all of those numbers, again, will go down tomorrow, predictably. But when we look at the other piece, we say, okay, where are we at when it comes to the CDC indicators? And we'll notice here that currently, again, the CDC says highest risk is a greater than 200. If we get to that middle part, that 50 to 200, on the CDC indicator or benchmarks, that would be kind of in the moderate zone, not necessarily in the high risk zone. So we really have to look at both sides and say, what is it that we're going to use in order to reopen safely for all of our students? As we continue to look at the next, hold on for a second, at the next piece, we'll see that this is another core indicator, and this has to do with percentage, positivity rate, right? And so we know currently we're at percent positive greater than 10%. However, we can get between 8 and 10%. We know that that would be in the moderate range for the Arizona Department of Health Service benchmarks. In this case, it's still in the high risk, but again, we look at this a little bit differently and say, all right, well, let's take that middle section as the moderate. And we believe that if we get below 10%, that's a good model for us. Then, of course, you start looking at the last core indicator, And that has to do with the implementation of the 5 mitigation strategies. So consistency of masks, the social distancing, the hand hygiene, the cleaning and disinfection, and then of course the contact tracing that we're really trying to do very well here at the district. We get a gold star here. So when you're looking at the CDC, we believe that we're implementing all 5 correctly and consistently. And every day we need to continue to do this even better, but that's where we currently are at. You'll notice also in the secondary indicators, there's a percent change for the CDC secondary risk factor, and it talks about over the last 7 days, what was the percent change? And so from this week, you notice that we went down significantly. We said 20 to 25%. And so right now, again, gold star, we're in that lowest transmission area, and that's great. When we look at percentage of hospital inpatient beds, we just dropped to 90%. So it was 91 and 92 for this other one. Both of these currently are at 90%. And then the percentage of hospital inpatient beds, I believe I saw the other day at 7%. And so we're in good ranges when it comes to saying, all right, when we look at the CDC core and secondary risk factors, what we need to really continue to look at is the, of course, cases per 100,000 and the percent positivity. But all of these other indicators, both core and secondary indicators, are really in a good spot. And this last one is about community outbreak. And technically, we're on a down angle, getting out of the second trend. When we talk about community spread, our community is vast. And we're going to get into that a little bit, say 19 different zip codes. And how is it that we properly give a prediction? And again, talking to Dr. Overland or emailing her earlier, that's a tough one and that's a crapshoot, but we're going to try to do it anyway. And so here you will see the community spread. Again, I overemphasize this. We have to take 19 zip codes, take all of those zip codes, and in some cases, we do have some up-to-date or close to being up-to-date numbers. And so when you look here and being the top range is the benchmark of reporting data. So remember, the data that reporting is actually 2 weeks old. So even though they're reporting the data on the 28th, it actually is from, say, January 14th. And so it's really important that we look at that. So we believe as we continue to look, you will see continue, as Dr. Woodbury said, and Dr. Overland, a downward trend in cases per 100,000. And we believe by March 4th or March 18th, we'll be below 200,000. Now, I believe these are somewhat conservative because when you look at the 19 different zip codes, some of your zip codes will be in a good range when it comes to percent positivity, cases per 100,000. Some of them will not be, and that could be due to lots of different things. Lots of our parents are essential workers, marginalized groups, different things of that nature. Maybe human behavior. Some groups, maybe just not actually in their community living by the social norms of the mitigating behaviors. And so as we continue percent positivity, I think this one will actually be the one that creeps down the lowest. But I'd love to hear what our special guest will have to say. And then, of course, COVID-like illnesses, we're seeing that drop. It's about 12.5, my guess, somewhere along the line. Tomorrow, maybe in the lower 12s to 11s, and we'll go from there. Now, disclaimer, these predictions are based on prior knowledge. Dr. Woodbury sent me the graph of what we saw last year from March on to see when this wave might come through again. It's also based on the 19 main zip codes. And then also, as Dr. Overland talked about, there's lots of different factors that these things could be interrupted by, especially human behaviors, additional waves, not doing what we need to be doing. So once again, community spread benchmarks talks about interpreting the benchmarks. I want to be clear that the Arizona Department recommendations, because we hear from lots of parents, well, what is this? Why do all 3 benchmarks have to be in the red? Can we have one benchmark in the yellow And would the state go back into a hybrid setting? And we have to remember that these recommendations are they're recommendations and not requirements. And so community spread data, again, is one of several factors we need to consider. We're going to talk about a couple other factors today. But if a school can continue to operate safely, Maricopa County Department of Health supports staying in a hybrid learning scenario. And I think with our components, we're watching the metrics, we're seeing the downward trend, we're watching our mitigation plan. And again, we're going to talk about vaccines. We believe that we can get back into in-person school. So questions on the benchmarks and indicators, but prior to that, I wanted to make sure Dr. Woodbury or Dr. Overland was able to comment on that section. Dr. Overland or Woodbury, let's go.
Would you like to go first, Dr. Woodbury, and then I can follow?
Sure. So, I mean, I think that what you're saying is correct. We have to think about the problem with some of the metrics that, and this is not news to anybody, is that, of course, the percent positives also depend on how many people we are getting to the testing groups. So let me give you some examples. So right now you might see a 17% or 19% or whatever for a large area like Maricopa County or something like that in the state. If I look at the sites that we are making measurements at, which now don't include hospitals, right? They're just sites that people come to. The most recent data is around 9%. So, and that's dropped quite a bit in the last few weeks. It was closer to 15 a few weeks ago, but it's dropped down quite dramatically. And so it depends on the population you're looking at. If you're looking at the population that's out and about versus including the clinical population, for example, which obviously is going to be a very high percentage in the mix. So this is always part of the complication with thinking about those kinds of numbers. Similarly, with the number of tests per 100,000, well, that sort of goes the other way. The percent positive will probably get smaller if we test more. The numbers, of course, will go up if we test more, just because you'll see more people if you test more people, because you'll hit more of the people that aren't showing substantial symptoms. So it's always a complicated thing to interpret these.
Dr. Overland?
Yeah, so completely agree with everything that was just said. I think what we've seen from a trending standpoint, like we talked about earlier, I anticipate that will continue to go down. I think as we're looking at the timeline for, potential in-person or hybrid, part in-person, part online, March is a reasonable goal based off where we are now and where we would ultimately like to be. As we get into that fourth quarter, I want us to remember that we are going to spike after spring break. Like, it's not rocket science. We've seen it after every break, fall break, Thanksgiving, Christmas. We even saw it after Labor Day, July 4th. Like, anytime there was a significant holiday that people gather at. So even if our families are just visiting other families in the state and they're not traveling out of state, they're being exposed to more people in a close situation, we're going to see a spike. So as we're starting to think about, hybrid versus 5-day in person, then you have to think what risk makes sense when we know our numbers are going to lag 2 weeks behind and our kids are going to be gone. And if we go right into 5-person full day school and all those kids are just coming back, does that make sense? Or does it make it more sense to try to allow more social distancing and more cohorting for at least the first couple weeks till we get our kids back in the school? But also that allows them, the all-important social interaction and the engagement with the teachers that is really hard right now on a full online platform.
Thank you. So once again, I just wanted to say, when you look at the 19 different zip codes, and I have for now the last year, I think it's going to be really important that some are going to be very low, and we'll see that. And some of our school communities, individual school, may be low and may be ready to go back, where others of our schools may not be. And so we need to look at it as a whole. That's why we took this as a whole, all 19. Again, was able to average these, but I do believe that these are conservative numbers, and I do believe they may trend down even further than what I've showed to you today. But I wanted to give you really probably worst case scenario.
All right, we'll continue with questions. Board members, just so a reminder, and we have about less than 40 minutes, so we will go on with questions in the same format we just did. Member James?
Yes, Mr. McDonald, do you mind going back to that benchmark slide real quick? My concern, I think, echoes what Dr. Overland was saying about spring break, because I'm seeing that the light blue date of real-time data versus when it's reported. And as a parent, I'm seeing March 4th, that top darker blue. I'm going to be seeing those metrics. And then while my kid is on spring break, I'll see those top blue March 11th metrics. And as a parent, I'm hoping that I know the district has said we're going to watch the metrics and go back according to X, Y, and Z. And so going back March 15th, right after spring break, I also know that my children's peers may have been traveling, as Dr. Overland said. We're going to see a spike. My biggest concern is that when we go back, we stay back, that we set explicit metrics for what would cause a return to virtual in hopes that we never have to use it. But in order to avoid that return to virtual, I would like to, thank Dr. Overland for that kind of more cautious approach of knowing we're going to see a spike. How could we approach this in a more hybrid way, or, virtual then hybrid, and ease in, because that 5 days a week is a pretty quick transition for our kids, our families, our parents. And, I'm looking for ways we can ensure that parents have faith we're following what we said we would follow.
Yeah, I think we're going to be able to show you maybe some of that as we continue the presentation today. There are options, of course. We do know that the hybrid setting, we're listening to our teachers and even our students and our parents, doesn't seem to be working. And so we do need to be creative in the conversation, that we're not just doing it to get them back, but also to provide a quality education. So let's continue, and I think we'll be able to answer those questions as we continue, and if not, we could ask the question again.
Awesome, thank you. Member Hodge?
You know what? I was going to go off Board Member James, but I think I'll wait for the rest of the presentation to go on.
Right. Thank you, Member Hodge. Member Montero?
Yeah, I also wanted to kind of go off what Board Member James said. We can get into that later once we go further on. But I also had a quick question kind of going back to this, what we mentioned earlier and seeing the decline in testing. So my question is, how much do you think that the decline in testing that we're seeing is contributing to the decline in the percent positivity or the cases per 100,000? And do you expect the number of people getting tested to continue to go down? And if so, how should we approach that, or kind of adjust in looking at the numbers when we're considering to reopen or not?
Thank you, Mr. Montero. I think there's a direct correlation, but I'd like Mr. Woodbury, or Dr. Woodbury, or Dr. Overland to go ahead and comment to that.
I think with regard to the percent positivity, actually, if you decrease testing, generally speaking, the percent goes up, because you start to be more and more dominated by the clinical setting, where you're going to have a high percentage. The other way around, though, with the total number per 100,000, if you test enough people, you'll see more positives. So those two things sort of go in opposite directions. As for whether the testing will keep going down, I think that really depends on people's attitudes, and again, how we message, how we encourage. It's something we're paying a lot of attention to at ASU. We're trying to come up with ways to help the community understand how important it is for them to know where they are and what their situation is. It's part of the engagement.
I want to interject just quickly, and I know, Sean, you need to get going. Dr. Woodbury, you mentioned the unstructured social interaction. I would assume that a family function with masks would be warranted for everybody, to just as a precautionary measure until, you know, we're navigating through this more confidently. But at this stage in the game, it's those kinds of unstructured social interactions that I am pleading for our students and our families and community to help us out, so that we can take control over our own community spread and metrics. I can't control, or none of us can control really outside of our own community, but we have a lot that we can do within the Tempe community, and I'm asking that everyone does their part.
If you can do things outside in our glorious weather, and wear masks, the percent probability of picking up the virus goes down dramatically.
Thank you, Dr. Mendenhall, for that clarification. May I continue, President?
Go for it, yes.
Thank you very much. So as we continue in talking about vaccination planning and information, right now we're in phase 1B, and of course our educators and our child care providers, along with law enforcement, those over age of 75, you'll see here that that's currently where we're at. This was prior to this weekend, so phase B, the doses given. We just saw today, Dr. Overland sent me over an amazing article that shows Arizona has over 1 million vaccines to give out. They gave out maybe about 58% of that. There are about 38 in the United States as far as where they are with giving out the number, so the percentage of vaccination. So we have a ways to go, considering we have about 7 million people here. Of course, we are one of the pods. Point of contact it is myself, and happy to say that we're going to be having a Tempe Union pod as well, February 19th and the 20th. And so we have worked with the teachers, and teachers have gotten their vaccination, the Pfizer vaccination, at the regional pods. We've had 3 opportunities, one with the regional pods, 2 with the Phoenix Union and Tempe Union pod. And then this last weekend, we had the Chandler Unified and the Tempe Union pod. And again, we'll have the second dose for Phoenix on the 26th and 27th of February. And then we have confirmed, so it says tentatively, but we have confirmed we'll have a Tempe Union pod here on the 19th and 20th, and be able to invite Phoenix, Mesa, and Chandler to that pod. So some of the vaccination surveys, you'll notice here that approximately, 794 took the survey. 783 of them answered the first question, certified and classified. So majority of your people here is certified. 67% took it. The first question was, did you take advantage of getting your vaccine at the Phoenix Union and Tempe Union pod? And out of those, 417 did, 377 did not. So what happens with the next questions is these 377 that did not were asked the question, if you didn't take advantage of the Phoenix Union one, did you get a vaccine? And out of those 377, 196 of them have. So the beauty of this, of the 794 respondents, 417 took advantage of the Phoenix Union pod, 196 took advantage of the regional pods, for a total of 613 having taken the vaccination out of the 794. So 77% of the respondents have taken the vaccination, which we thought was a good effort. We still have about half of the other people that did not take the survey. So we will continue to do surveys and try to get that information as we go. We do know, we said, well, if you didn't get the vaccination, when would you get it? So you see here in 4 weeks, at the end of the 4th quarter, during the summer, some, 39 out of the 794 said it's never, right? Other was 65%, and that ranged from medical, being on chemo, waiting for Johnson & Johnson, all of those type of things were commented. for a total of 177. And then, of course, we said if we were able to do a pod, would you use the Tempe Union, Maricopa County pod, like we have set up on February 19th and the 20th? Or would you rather just do it with your healthcare provider? So it's about 50 and 50, the 122 that will still continue to get their vaccination. So it seems like most people will get their vaccination. The respondents, 77% did, and only about 38 said, I'm not doing it. So a little bit, about 5%. A little bit about the vaccines, Pfizer, Moderna. Of course, this is an mRNA vaccine, and so they don't contain the complete virus. They have this viral genome that makes the body have some immune response to it. And then again, the results of this immune system creates antibodies to the viruses without becoming infected first. So that's the idea of vaccinations in general. So this is a little information on the Pfizer. Highly effective, 95%. Both of these require 2 doses. Pfizer is 21 days apart minimal, but doesn't have to be exactly. Available, as Dr. Overland said, 16 and older. And this is the ones that need the ultra cold storage. And this is why it's so good to have it, the larger regional pods. And then you, of course, have the Moderna, highly effective at this point as well. I think it was 90.4% the last that I've seen. This is a minimum of 28 days apart, available to individuals only 18 years and older. And so, again, this vaccine is better suited for the school pods, and that's why we're seeing the educators get Moderna unless they went to a regional pod. Again, we talked about the ages, talked about the intervals. This does not cause COVID by getting the live virus. You cannot spread infection by getting the vaccine. And though it is possible to get the infection before the second dose, we do look at the efficacy rates. And so you'll notice here, Pfizer gives a lower dose in micrograms, but the efficacy after 2 weeks can be up to 82% after taking the first dose. Again, an equal amount the second dose, and the efficacy could be up to 95%. And very similar for Moderna, they could get to about 80.2%. So I know myself, I took my shot as of tomorrow will be 2 weeks. Technically, I could be at about 80.2% after taking the first dose of Moderna. And when I take my second dose 2 weeks, after that, I'll be up to 94.1%. This was a little interesting, how coronavirus vaccines compare to other vaccines. And so when you're looking at a flu, and there was a question about the variants, you know, the flu has lots of different variants. And so we saw that the efficacy or the effectiveness of the flu vaccination is about 44%. And so when you look at AstraZeneca currently, they're about 70%, chickenpox about 92%. So you got Moderna and Pfizer both at 94 and 95%, where the measles, MMR, polio, those type of things are much higher at 97 and 99%. But as far as vaccines for viruses, these two vaccines are very, really realistic, high percentages, and equal in doses for majority of vaccines. So Dr. Overland or Dr. Woodbury, anything on vaccinations?
Well, a couple of comments just about the vaccines, particularly the Pfizer and Moderna vaccines, the mRNA vaccines, which are the ones that are out there right now. So remember that those percentages are based on how many people became ill, right? They're symptomatic percentages. They haven't actually measured yet, and we don't really know whether or not you can become infected and not become ill when you've been vaccinated. So we don't yet know about how well they stop transmission. We all hope that they will slow transmission way down, and I think that's a reasonable hope that is the case. But we don't have data on that yet. So bear that in mind, particularly if you're thinking of throwing a party after your vaccination. That's not something that I would ever advise that you do while we still have a high rate of the disease, because you don't want to just be passing it on to somebody else. The other thing is that while yes, after the first dose, there's efficacy, and yes, that efficacy is probably as good as the typical flu vaccine. Still, it's this is a more deadly virus. So so I would not take your chances after the first shot. I would be just as careful. In fact, I think that we need to be, as a community, just as careful until the rates overall for the community have gone down. So I'm trying to emphasize to everybody, it's still all of our responsibilities, whether we're vaccinated or not, to get this viral concentration in the community down.
I would add just a couple more things to that. The new variants, the mutated versions of COVID-19, they do theoretically believe that the vaccine will provide protection, whether it's complete or partial, we don't know, but it should provide some protection, meaning when you look at also 95% efficacy, it means 95% of people, even if they were exposed to COVID, either didn't develop symptoms or developed a mild case. So that eliminates moderate and severe. So could those, with the changes in the mutations, you're going to have some protection, just like influenza. If it's a different strain, you get some protection against that strain, but you may still get true COVID symptoms with some of the newer strains. So that's important to realize that we don't know that yet. And then also, again, we're not going to be getting on a mitigation strategies because we've been vaccinated. I mean, I've received both my Pfizer vaccines. I think I'm more than 3 weeks out from my second dose. I still have to wear a mask and eye protection when I see every single patient in my clinic. And that's not even a sick clinic. I'm in sports medicine. So it's going to be helpful because we're going to be reducing our at-risk populations. But I don't want people to think this is going to be the party that everyone's hoping it will be, and that we're going to still be doing mitigation factors for quite a while despite the increasing vaccine rates. Just because from a community standpoint, it's going to take a long time for this truly to be under control, even with the vaccine rollout.
Dr. Overland is absolutely right. We just have to be, we can't just let up at this point. And we don't know what the new strains are going to be. They will be here eventually, and we don't know what the interaction is yet.
Thank you so
That's
much.
what we'll talk about, the mitigating behaviors next. It's still going to be so important to continue the process.
Thank you, Member Hodge.
I want a myth buster. I've been told that people are saying that if they get the vaccine, both vaccines and the flu, that would help them protect. So I want that to be out there that that's not true. So I get an expert to say that's not true.
What did you say again? I'm sorry, I didn't quite understand.
So if you get both COVID vaccines plus the influenza vaccine, you'll have better
coverage.
Go ahead.
You're protecting yourself against two different things, right? So if you get influenza plus COVID, that would obviously be a much more significant, severe situation because you're already getting a virus that we know has very significant short-term and potentially long-term effects, and you get influenza, your immune system obviously would be more likely to not deal well with two significant viruses at the same time. So it behooves you to have the influenza vaccine and the COVID vaccine, but it's not an additive effect. They don't work symbiotically and add together for more protection for either virus.
Thank you so much. Member James.
Yes, so we're talking about mitigation strategies and the importance of keeping them. So my question is, with a good fraction of our staff vaccinated, when staff is exposed potentially and they have a known exposure, would we be following our current quarantining standards? And how does that play out with, our sub shortage, if we have that, or like, have we talked about sub coverage? Just knowing some of the issues we ran into, I guess, are we going to maintain the same strategies there?
Yeah. Yes, Ms. James, that's the next section. You're beautiful at the segue, so I appreciate that. We'll go ahead and get into the health mitigation strategies. We'll keep all of those. And I know Dr. Mendeville will talk a little bit about the subs as well.
Okay, before we move on, Member Montero has a question.
Yeah, real quick, Mr. McDonald, first of all, I want to say that I'm really glad that a really good portion of our staff are getting vaccinated. And I kind of want to go back to something you hinted at earlier, back to the survey that was sent out. In comparison to the total amount of staff that the survey was sent to, how much of a representative sample is that? And I don't know if you have the data on that. I can follow up with you. I also want to make sure that this is, a representative sample of our district as well. So I don't know if you have the numbers on the different sites of where the respondents were at, to make sure that we don't have, certain parts of our district that might be overrepresented in this survey. Is that something you have?
Dr. Alexis was working on that.
Yeah, I have that in front of me, Board Member Montero. And of our certified responses, we had 528 of our 712 certified staff responded. So that's 74% responded. I have the numbers for each of the schools, and I'll just say them briefly, but this will be shared with you because this was just completed this afternoon. Corona has 50% of its teachers as of right now, and this is likely going to higher, 50% of its teaching staff, and this is just with teachers. Desert Vista 64, Marcos 58, McClintock 49, Mountain Point 55, Tempe High 60, and the district office was at 88. So these are good percentages, and I think as we move forward in the coming weeks with the next opportunity for the vaccination February 18th and 19th, I think this will also improve, and we'll have even better numbers. So comparatively, in talking to some of our sister high school districts like Phoenix Union, our numbers are quite good.
Great, thank you. Mr. McDonald, you may continue.
Thank you very much. So as we get into the mitigation plans, as Ms. James talked about, in the CDC health mitigation strategies, regardless of what the indicators determine, it's critical to ensure the use and layering of these mitigation strategies. We cannot get away from these. We'll continue the same things that we're doing. And you know what, we'll probably do it through next year even. And we need to be realistic about this. The consistent and correct use of masks, the social distancing to the largest extent possible, hand hygiene, respiratory etiquette, cleaning and disinfecting, and of course our contact tracing in collaboration with Maricopa County. Schools should adopt. We will continue to look at the mitigation measures. There may be more that we need to add to our plan as we continue, and we're always looking at that, and we will continue to do so. So again, mask, don't have to go too much through that, and physical distancing. We know that we have these campuses set up, try to be at least 6 feet apart when possible around the campuses, one-way walkways, signs, arrows, you name it, hand hygiene and respiratory etiquette. We have all the cleaning and disinfection. I have just talked to the warehouse, Mr. Thorby, Mr. Riley. We have the stuff ready to go on our campuses, hand sanitizers, the cleaning, all of the things that we will continue to do and have done. Contact tracing, we'll continue to utilize the systematic contact tracing for students and for our teachers and staff. Dr. Overland supports that. Our trainers support that. Our athletic and directors and our activities people support that, and we'll continue. And of course, our nurses, can't forget them, and Mr. Cobbs and myself. We want to make sure that we're keeping safe schools by doing proper contact tracing and not just layering and saying, all right, everybody home or just that person home, which we know that happens in other areas. Community spaces, we want to continue to kind of close as much as possible, but if we need to use them, stagger and clean them before and between uses. Of course, we know that if we're sick, stay home if possible. Talked about the adequate supplies, and we have adequate supplies and our mask, and our community has been very supportive and donations and everything else. Our ventilation systems operating properly. We've increased the circulation of outdoor air all the way as much as 20%, while still continuing our HVAC systems to work at high levels. As it gets hotter, we want to continue that. If we move much more than 20% of the air, the buildings are going to get too hot or too cold as well. But there are places in our buildings that we could have 100%, say in our gymnasiums or different things of that nature, if air is not necessarily the biggest factor. Physical barriers, as you walk around all of our campuses and district offices, we have our sneeze guard partitions in the reception areas, cafeterias, front office staff. Water systems, every time we close a school down, we want to make sure that we clean our water systems out. So I know that Mr. Thorby and our maintenance staff are working on that, making sure that these are ready to go. The sinks and the faucets, refilling stations, our toilets, everything is working and functioning properly. Food service will try to avoid doing all the self-serve food, but we'll have food for our students once returning. And this is something that we're going to be using as well in the next few weeks with our staff. This is a symptom self-checker, and Dr. Woodbury at ASU, they use something very similar to this. We're using Qualtrics. I'm not sure, are you using Qualtrics as well, sir? But we're going to use that product.
It's a homegrown one, but yeah, similar kind of idea. So,
and what it does is ask your questions, and based on that, it will actually give you your response. Based on your responses, you're eligible or ineligible to come to campus today. And that way, they will show this to the front office, the security guard, whoever is at the post, before they can come into the building. Okay, and then once we feel good about using it with the staff, we would like to use it with our students as well. And of course, capacity all determines about the layout of classrooms, space, and seating. We still want to be able to have seating charts to make sure that we can know who's sitting and help us with our contact tracing about viral spread. And of course, they'll be clean each and every period, between periods. And we still will continue to have our desks trying to face forward. That's just a mitigating factor that we believe that, you're not facing each other and whatnot. So the last piece here, I wanted to kind of come across, and I know Dr. Mendeville will speak to this a little bit, but what could it possibly look like? Going through what we went through today, the components of the mitigation plan, the components of the metrics on the downward trend, the components of the vaccination. Can we look at, and currently when you look at this, the 4 boxes on the bottom are the actual ability for our staff to get vaccinated, right? So far, they've had 3 opportunities. The last one here coming up on February 19th and 20th, and actually not the last one, the next one, I should say. But right now, we're in the virtual setting, and we're suggesting, because of the metrics, we believe that by spring break, we should be able to get out of that, and right there when March break comes in, we should be able to say in-person learning for teachers and students returning to the classroom. In doing that, we believe that our teachers need to return a couple weeks earlier, and we have looked at probably a start date of February 22nd, because the culture has to continue. The mitigating behaviors have to make sure that they're continued. We need to make sure that our classrooms are ready, that our campuses are ready, that our technology is ready to service the students that are going to come into our way. Dr. Mendeville, did you have something that you wanted to share with this?
No, I think you covered a big piece of that piece. I think, in fairness to the metrics, Mr. McDonald and using current data has projected out fairly accurately, I think, and in some instances probably a little bit more conservative. But the things that we have control over is what we have to focus on, and one is our behaviors. And so I want to say that over and over again, and I know that Dr. Woodbury and Dr. Overland are saying, Green in that we really have to be mindful of that if we're going to have any sort of positive trajectory to move forward. I think beginning on March 15th, in person is a very realistic goal. We've talked about 5 days in person. We've talked about, being able to pivot dependent upon the data that is being shared, so that we are responding as we have done in the past, using the data wisely. But the trajectory is favorable right now, and why I'm very encouraged by this is for the mere fact that we will have the vaccination. I know very well nothing is 100% proof, but it is a protection. And that is what both Dr. Overland and Dr. Woodbury conveyed. It's a protection. And so while there's some unknowns, or maybe a lot of unknowns in terms of true efficacy and that kind of a thing, but it does provide protection. And those are the pieces that I know our teachers are concerned about. I am very concerned on a lot of levels that time is not our friend right now. And so I'm concerned about our students struggling academically, social, emotionally, and in a variety of ways. So they need to be back at school, on campus, and ideally 5 days a week. What I'm trying to prioritize, at least right now during this session, is that I think we can all come to terms and come to agreement that I'm not going to speak for my board members, so I just want you to know that. But I'm just saying for myself, I don't see any huge reasons why we couldn't entertain that as an option. But having a target date, something to shoot for, if you will, we can backwards design and plan accordingly to receive our students. And that would require gathering input from our students. I'm speaking with board member Montero and others. Yeah, we need to do that. We need to do a parent survey. And we would need to do some follow-up surveys with our teachers so that we can be focused and deliberate with our planning for a successful return of our students in March.
Thank you, Dr. Mendeville. Questions on mitigation plan and strategies. I know Dr. Overland, Dr. Woodbury, you spoke already to the importance in conjunction, of course, with the vaccination. The mitigation plans are going to be super important. Anything else that you'd like to share?
I think there's sort of a couple of parting comments on this. One is that that it really is the case so far, and studies have been done in the K through 12 arena around the country, that the structured environments are not where most of the transfer is taking place. So given that we know what a burden it is, or a burden on parents, difficulty for parents, for students not to be in school, but just as importantly, more importantly, what we know the effects of not having the kids be able to go to school for long periods of time. I think we have to take those two things. There's never no risk. There's always going to be risk, but we have to try and balance those two things. And I would encourage you to work as hard as you possibly can to get the students back in school from that. The other thing that I point out is that it's so important that we work to move the levels down. Again, this is mostly going to be behavior in the short term. Move the levels down, not only just because that will get the students back in school, but because remember, when the levels are high, that's when the virus can evolve, because there's a lot of virus and it's out there, and it's just every time it cycles, it has a chance to mutate. So getting those numbers down helps us keep that from happening, and the negative results that could happen from that.
Thank you, sir. Dr. Overland?
Yeah, so actually that last point about the high rate of transmission equals higher chance of mutation, I think was an excellent one, and one we haven't brought up. I think the hardest part, and we've seen this in athletics, is the consistency of trying to control the mitigation factors when the kids are in school, and just the constant strain of repeating yourself 5,000 times in regards to them. I mean, these are high school students. Like, you know, I have a 17-year-old. She doesn't want to wear a mask when I tell her to either. So I think that's the biggest challenge to our kids returning to school, because I agree that we're not getting the spread when they're doing the right things. We're getting the spread when they're not doing the right things. And we can't control the families outside, no matter how much messaging we set. It's an unrealistic expectation. You're not going to control a 45-year-old guy who wants to go wherever, like that, you know, from a school standpoint. They may want their kid to go to school, but they don't see that as a one-to-one connection. So you're not going to get them to buy into that if they're not going to buy into it. Either they're going to agree or they're not, and you're not going to change their minds at this point. But I do think that from experience too, when we've been following the mitigations, we do great. Our spread is minimal to non-existent when we're doing them. So we've had a lot of success when they're followed. We always run into problems when they're not. So if, you know, whatever that's going to take, if we can do it the right way, I totally agree. Having kids in school is better from a learning standpoint. They're more engaged. Socially, it's better. Like, there's a gazillion benefits. So we could list those all day, but 100% kids are getting lost in the wash when they're trying to do all online school, whether it's they can't keep up with the material or just being at home. Like, they're not going to be as naturally motivated, or they get pulled in other directions. I mean, you have a lot of kids who may have younger siblings at home, and they're responsible for their siblings getting on and not even their own high school work because mom and dad are both working. So we have a lot of reasons that our kids are going to be better off in school if we can get them to buy into doing it safely, and the teachers are reinforcing it, and everybody's playing on the same team when they're in school.
I have 100% confidence in our students that they're going to want to do their part. And same with our teachers and staff. And I'm being given the speed it up or just be quiet so let everybody else speak. So, President Garcia.
Thank you so much. We have about 10 minutes left until we have to start our agenda portion of the meeting. So we will go in order of who raised their hand. So we'll start with Vice President Barraza.
I won't ask any questions. Instead, I will just give comments and insight for things to consider. I think, for one, the self-testing plan, I don't have a lot of faith in it, considering that it's relying on truthfulness, and a student or staff member that wants to go to school will make that test look, you know, pleasing. So that's one issue I have with that, but that's not really the big concern. I guess in the mitigating strategy, I'd like to hear more about, you know, in the future, how to try and control mitigating factors. We know, as we just talked about, that students will not, you know, at times abide by it. So what do we put in place in order to correct that behavior for students or staff that just don't want to wear the mask, but they have to, and, you know, and putting a lot of other people in a dangerous situation? So do we put them into virtual? What mitigating factors? So I'd like, you know, for people to think about that. And in respect to that, how teachers are supposed to handle it. I think they need to have framework and say, you know, if this student is in our classroom and they just flat out refuse to distance, wear a mask, and you know, they're just not going to do it. So I think teachers need a lot of guidance on how they're supposed to handle those interactions, because we are talking about mitigation plans and strategies. And again, it only works if we all, you know, work together on it. And when we do, it has tremendous success. So I'd like to hear more about that kind of relationship in the future. But that is all, and thank you for the presentation, everyone. I appreciate it.
Can I comment on the health check?
Yes.
So your point is certainly well taken. It's based on truthfulness. It's interesting. It turns out, and I think this is particularly true with young people, at least in the university, if they actually have to lie, rather than just ignore the truth, there's a significant fraction of them that won't actually lie. It's a funny thing about psychology. It's okay to just say, well, I'm not going to think about it. I'm just going to go do what I do. It's another thing to push the button and say, I'm healthy when I'm sick. So I just put that out there.
Member James?
Yeah, I have a few thoughts as well. I'm thinking back to the timeline, the benchmarks, the metrics we potentially will see that our parents will see. And if we are looking at a 5-day return, I'm very hesitant about that because we're talking about the need for mitigation strategies, especially when we're still in substantial spread or teetering on the verge of, or coming back from spring break that could potentially put us back there. And the social distancing aspect potentially won't happen in class if our classes are, you know, we're 5 days a week. That said, we have a few other things. We're looking at the vaccination schedule. Our teachers returning 2 weeks prior. They're going to be working with their colleagues, albeit spread out. But they may have kids that are also still remotely learning. And I know when we did that last semester, there were a lot of issues with that some teachers had with that 2-week return, maybe not having 2 weeks total beforehand, you know, working with the teachers on that, what they think is what would work for them best, especially our teachers with young children or our teachers that aren't feeling, you know, like they're not fully vaccinated yet, that hasn't kicked in, or they have at-risk people at home. We need to talk about how we're accommodating those educators as well. And yeah, I don't know, there's a lot. I think that also we've talked about the hybrid not working for teachers doing the 2 modalities of learning. And I don't really see how we get around that because there are going to be families that, especially if we go back before they are ready, if they're looking at red on their, you know, Thursday morning and they see us in the red, they're not going to send their kids to school. Then we're going to have a lot of kids online. And I've even heard from teachers saying, I've talked to my students, I have about 75% of my kids that want to stay remote. I have 25% that want to stay remote. Those teachers are going to want to give the best learning environment for all of their kids, including the remote kids, and will end up doing that same remote learning that they did, the, you know, 2 modalities of learning that they did in the fall. So we need to be cognizant of that. And if we're going to come back to stay back and really kind of grab as many of those students that signed up and said, yeah, we'll go back when your metrics look good, then we really need to keep our mind, our promise, keep our eyes on those metrics, look at when our teachers will be most of them will be fully vaccinated when we start asking them to come back. So yeah, that's just kind of when I'm looking at the vaccination, the mitigation, thinking about where teachers might be. I also don't think that they can, if they're going to have all those hybrid kids or the remote kids, that they can give up their asynchronous Wednesdays. I don't feel like that would be fair to them. So those are all my thoughts on that section. Thank you.
Thank you.
All right, Member Hodge?
You know, due to time, I'm gonna sustain my time. Board Member James went over a couple of things I wanted to talk about with synchronized, and also just having a plan for if we can't go back 5 days. What is it gonna look like, and what can we do differently? That's all I'm gonna say. Thank you.
President Garcia, we have 3 more slides that Dr. Menifeld wanted to go through, and then I didn't know if we had option to do so.
Yes, so we will, here's what we're going to do, board members. We're going to go a little bit over time for the next meeting because I do want to finish this portion of today's session. We only have a few more things. However, the next portion of questions need to be real quick because we have business to get to. So Member Montero, and then we will go on to the next portion. Mr. McDonald.
Thank you, sir.
I'll be super quick. I do want to echo a lot of what Board Member James said, especially when it comes to, I am very hesitant to do a full 5-day schedule. I think at a minimum, being able to keep this asynchronous Wednesday, not only for our staff, but also to give the opportunity to do a more in-depth clean between, you know, in the middle of the week to make sure that we're keeping that up. And the other point, just looking at, the metrics, I know board member James mentioned this earlier, is that we also need to keep in mind, when we're going back, if we go back in person with, right after spring break, beginning of fourth quarter, when we're not going to be able to see these spring break numbers, as a board, we need to have that discussion of, what are the numbers that we're going to be looking at to making sure that if we get to the point that trigger to where we would have to go back virtual, because the last thing I want to do is to jump the gun and have to flip flop going back and forth, because when we talk about disruption to our students' education, I think going back and forth like that when we act too early is a detriment to our students' education. So just keeping that in mind.
Thank you so much, Mr. McDonald.
Thank you, Mr. Garcia. Dr. Mendola, did you want to go through these?
Yeah, I just wanted to, there were some questions earlier that were talking about the substitute coverages for absences when we were in the hybrid AB model. And, if there was something loud and clear from our teachers and from our students and from pretty much everybody involved in the educational process of our students, is that the hybrid model, while it might work for our college age and adult folks, it's probably not advantageous for our high schoolers. And so just looking at some preliminary information from August 1 and through December 18th, the non-COVID related averages numbers for class periods covered, and these are non-COVID, we're about 2.0 periods, okay? And then when we take the COVID related, it's about 2.1. So looking in that period that we just experienced with hybrid, it didn't change a whole lot. And again, the most common period covered was the very first period of the day. By far, we had the most, and the average number of days was 20.7. The cost for substitutes during the hybrid period was close to $37,000 that we spent. And so there wasn't a lot of change was a big thing there. And I also wanted to talk about the teacher think tank that we met. I had members from all 7 of our campuses, and we met virtually. And these were some of our finest teachers across the board in a variety of curriculum areas. And what the task for those meetings was to figure out a way in which we can return, again, not knowing where the metrics would be come January, what would be an alternative instructional mode to return that would promote engagement, because that was the key piece. That's what we're hearing more and more with the hybrid and virtual settings, that it's the engagement. We're losing our students. And so realistically, they had some great ideas. They actually had 8 models that we looked at. And the biggest challenge for a high school only district is the master schedule. And when you develop the master schedule at the very beginning of the year, which we will be starting for the 21-22 school year, there's so many variables and components that we look at with the and I want folks to listen to this, because we can't mess around with instructional minutes. We can't mess around with seat time. We can't mess around with all those kinds of things, because we're audited. We put ourselves at risk to be audited. And but the master schedule development changes were too severe to make at the middle of the year. So what we're doing is, and you can change the slide, oh, never mind, don't change it yet. But that what we're doing is there's a team of folks from respective appropriate areas to begin planning a contingency instructional plan. So in the event, I look on the bright side, things are going to get better, but down the road, should this kind of event-driven closure happen, that we are able to go into a contingency instructional plan that addresses engagement completely. And so because that's the focus piece. So, but there's a lot of structural changes that have to happen with Synergy, our student reporting system, and then Schoology, and many other platforms that need to all be talking to the same. So I want folks out there who have asked what had happened with the meeting, and this was the outcome. So again, a high school only district is very, very different than a K-8 system. We're working in fractions. every employee is fractioned out to 5 if they're full time. These pieces of someone's contract are scattered throughout the schools and districts, and it's chaotic. So that's what I want to say on that.
Thank you, Dr. Mendenhall. Your point to the hybrid A and B model, it was clear that the teachers and students and families did not necessarily find that a valuable option. So you may remember this from the past, where Tempe Union, the scenario 3 is what it is, and that first round of cases also it comes right from the Arizona Department of Health Services. But we tried to do something before and create this hybrid model, and you'll notice scenario 2 days a week, and that's exactly what the teachers and students are saying was not working for them. So if we were to take that out, you'd have to take out how to get from scenario 2 days to scenario 2 4 days a week. So if you took that out, now we're left with a scenario 4 days a week, and then the cases or the benchmarks to get your traditional. And so I wanted to leave you with that. And I think that would answer your question, Sarah, to what was being asked prior. Additional information, I think, Dr. Mendenhall, you spoke to the rest of the outcomes. Did you want to speak any more on that?
No, I just that the outcome, the block schedule, 3 periods per day versus 6, seemed to be the one that worked, because it gives our teachers more time to group students and have more engagement opportunities for their day, and so they're not. It's just a better use of time. But that's something that we would tease out in detail and then put in a contingency plan.
So in closing, again, the goal and outcome is to have a safe in-person instruction for everyone. The variables for consideration that we spoke of today were community spread and metrics, the benchmarks and indicators, the vaccination plan and information, the mitigating plans and strategy, the additional information Dr. Mendenhall went through, but also significant considerations that we did not talk about, simply did not have time to talk about. Safety and security of our students when they're away from us, the diversity and inclusion for all of our students, the social emotional wellness factor for our students and for our staff for that matter, and the academic success that we know in the virtual setting may not be as robust as we need to have it. And so I want to appreciate Dr. Overland being here today, and Dr. Woodbury, our special guest. I appreciate all that you've given us to think about, and with this, closing questions and discussions. Thank you very much.
Yes, thank you so much, Dr. Oberlin and Dr. Woodbury. We really appreciate your support and guidance, especially through this difficult time. It really means a lot to us. Board members, at this time, we're going to be quick with questions, 1 round through, no second through, so we can have a break and then go straight into our formal meeting. Vice President Barraza.
Okay, yes. Thank you again for the presentation. I'll be quick. I guess looking at the mitigation factors, the days a week, I do think it's important that we look at a week in which staff can come back, do their assessment, and really work towards kind of understanding the classroom dynamic. And maybe those couple days a week with the asynchronous would work, and maybe those need to be full everyone in person. I know the hybrid model said, this cohort on these 2 days and this cohort on these 2 days, but I think maybe 2 days of full instruction and let them understand what that dynamic is before they're thrown into a whole 5-day-a-week environment, especially when we have to consider various variables that are going to be very complex at that rate, from transportation to, food service. So I would say if we are coming back, I can see us going back to a 5-day scenario with mitigation, with vaccinations, with the help of staff being able to provide their own criticism, critiques, and advice for their own classrooms. But, and I said I wasn't going to bring this up, because there's been various discussions, but I also think that we ought to be talking about compensation during that period in the terms of hazard pay. We are going into a dangerous environment. We're asking staff of all levels to go into that environment. And we should also consider the district and the district staff and what they've been doing for this entire period and what they're going to be asked to do when schools open up 5 days a week. There's more exposure to it, and I think it is something that we really need to consider. So if there is a 5-day-a-week scenario in play, I think it has to come with some type of hazard pay discussion. Thank you. That's all.
Thank you, sir.
Thank you. Any other board members have additional questions or comments? Member Hodge?
Okay, thank you. I just want to thank you, Mr. McDonald, Mr. Woodbury, and especially Mrs. Owen for all your input, information. I know that we're at a point that we have to bring our kids back to school sometime because they're suffering academically, emotionally, and they're also suffering emotionally and socially. But I also want to make sure we do it with all health mitigations all in plan. On that, I like the 4-day with the Wednesday synchronous because that also gives our teachers who does have kids who are going to stay virtual a chance to catch up with those kids also if they do it on that Wednesday. So I just want to put that as something that we need to look forward to. I know everybody wants the 5-day, but I know that we also going to have kids that are going to stay online, and we have to look at all of it because all of our kids' education is important. So that is my input on that. Thank you so much.
Thank you, Member Hodge. Any other board members? All right, if no more, then we will end the study session at this time. Thank you so much again, Dr. Oberlin, Dr. Woodbury, and Mr. McDonald, and Dr. Mendel for this study session. I think it's very helpful for us. As you all know, this will continue in the item in the agenda later in the agenda. So at this time, we are going to take a 5-minute break. We will return at, 7:15 and resume with the formal meeting. Thank you so much.
Thank you for having me.
Thank you so much.
Thank you.
Yes, thank you,
Thank you, Dr.
Dr.
Oberlin.
Oberlin.
Thank you.
Thank you, Dr. Woodbury.
No problem.
Also, board members, please turn off your camera and mute your mics while we're on this break. Okay. All right, thank you so much for joining us. Now we return for our regular board meeting. Before we go into our business meeting, I want to remind everyone that Tempe Union continues to maintain social distancing for the safety of our community. Excuse me. Board members are participating virtually, and this meeting is being streamed live on YouTube. Open meeting law permits a public body to hold a remote meeting through technological means and implement procedures designed to safeguard the public's access to the meeting. I am reconvening this meeting. The time is now 7:16. Welcome everyone. For the members of the public who are following the agenda, please note that item H, communications from board members, superintendent, and the executive team will be the last item of business before we adjourn. Now, everyone, if we can please stand for the Pledge of Allegiance. Dr. Mendeville will lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, a nation under God, indivisible, with liberty and justice for all.
Thank you so much. Now we're going to start our meeting with special recognition of our 2019 and 2020 governing board president. I do not have something that is prepared because primarily I wanted to recognize our wonderful former governing board president, former Madam President, Burdetta Hodge. She served, as you all know, as our president from 2019 to 2020, and is the first one to be serving in that role, and also the first Black woman to serve in that role and be elected to this body as well. And so through her leadership and through her guidance and mentorship, many of us have been able to be involved and engaged, and it's because of her that we're able to to continue doing this work. So thank you so much, former Madam President Hodge. And I think it's also important to recognize that it is Black History Month, and the prominence and the importance of having diverse voices on this board is crucially important. And you bring a unique perspective that none of us will ever have. And it's really important for us to continue hearing not only from our community members, but also the ones that have historically not been part of this board. So thank you so much, Madam President. There's so much to continue with this, but I do want to share that I will deliver you a plaque. That way you have it to memorialize your 2 years on this board in that leadership position, because it is something that not many people get to experience, but also the navigating us through such a pandemic. So thank you so much. Dr. Mendeville, I don't know if you want to add.
Yeah, I do want to comment because there's a lot to say, but you don't know is that you're going to have 2 plaques then. So we've got something for you. So just accept it graciously. But I want to tell you that it's been a pleasure having you as the president of the board these last 2 years. I think you've done a marvelous job in setting Brian up to lead the governing board along with our new board members, and with Andres as Barraza as vice president. So I think we've had good examples, good mentorship, and that's the one of the key signs of a quality and effective board. So Burdetta, all that you do is certainly noticed by many, because you do so much for our students and for our community. And I know, while not having a title of president, you're still going to continue to have the positive influence that will benefit our students, because that's where your heart is always. And that's one thing that I love most about you. So thank you, Ms. Hodge.
Thank you, guys. Thank you so much. I don't want to cry, so.
Well, thank you. And I know I will slip up and still call you Madam President, because that is how I've always known you. So, all right, we will move forward with the next item on the agenda, E2, with middle school enrollment. Dr. Mendeville.
I'm just really excited to introduce Mrs. Hilgers and the work that our community relations, our media department has done along with our schools. site leadership and assistant principals with the middle school program. And, you know, I'm going to let Mrs. Hilgers take it away, because we're very proud that while we are in a virtual mode right now, we're not seeing our wonderful students. Boy, our kids just produced and they make us proud. And so, Mrs. Hilgers, take it away.
Thank you. President Garcia, Vice President Barraza, members of the board, Dr. Mendeville, and the executive team. It really is my pleasure tonight to share information with you about our middle school enrollment process for our incoming freshmen. And I want to say thank you to our Director of Instructional Services, Stacy White, the counselors, and our assistant principals for academics, because they created these events that I'm going to share with you tonight. And as you know, in the past, we created and facilitated events in person, and this year we redesigned everything, so all the events were online. So it was a huge undertaking. Second, I'd like to give a shout out to our media team. Dr. Mendeville mentioned that, but I'll tell you, what they did this year was better than I've ever seen in any other year in Tempe Union. They created flyers that were distributed in all of our feeder districts, which included information in all of our events. From the print and the social ads, we reached close to 271,000 people who saw our ads, and they did a terrific job for Tempe Union and for our incoming students. So let me share with you what it looks like for our incoming freshmen. Our first step in that enrollment process is we orient our 8th grade students. And in the past, our counselors went to Kyrene and TD3, and they presented information in person. Well, this year, all the student orientations were held virtually, and that was January 12th through the 14th. We presented to approximately 2,400 students, 14 different schools during a 3-day period. So there was a lot of work that was done by our counseling staff. To help our families, what we did is we've got videos on each school's website. We have them on our district website. All the forms are fillable, they're downloadable. And if families wanted some hard copies of our course catalog, the sites could go to the school. We had a drive-through distribution at our high schools on January 14th, and we did that from 7:45 in the morning all the way to 6:30 p.m. And so they could get materials if they wanted hard copies. So after we went and oriented our 8th grade students, we held what we called virtual showcase nights. And so our 6 comprehensive high school hosted a showcase night, and that was on January 20th, where prospective students and their parents can explore the academics, the athletics, the activities, anything that's available to our students. And parents were able to join by clicking on the link that was available on the school homepage or on the district website. We also had additional virtual showcase nights. We wanted to showcase our specialty programs. So our IB program, our AVID programs, the Peggy Payne Academy, the dual language program, our Title I programs, all those we held a special virtual night showcase so parents could see and take a look at some of the special programs that Tempe Union offers. And then last, what we have done and will be doing again tomorrow night is we have what we call virtual Q&A and enrollment support. So on January 21st, on the 28th, and tomorrow, February 4th, parents can drop in and speak with a counselor or an APA and get all of their answers to the questions about enrollment. And what's interesting is we start that night with our college counselor, Mark Kulik, and he shares information with all the families about what you need to know about college before starting high school. Because as you know, that influences courses that you take, activities that you join, leadership activities that you incur as well. And so that is something that parents really, really like, is to get that information about what they need to know so they can begin to plan, kind of do a 4-year plan while their student is in Tempe Union High School. And so I wanted to show you a little bit about what this looked like in person. And so there is a video that Warren Cole did, and I hope that you enjoy it because you'll see some of our virtual activities.
Take an honors or an AP class?
Spanish. Mr. Smith, if you want to talk to anybody, any school in our field, definitely an in-class school
So proud of everybody, and I hope that gives you a glimpse of how we welcome our students and parents to the Tempe Union High School District.
Thank you, Mrs. Hilgers, and welcoming them in the Tempe Union High School District in a virtual setting. Pretty cool, I think. So kudos to all the people that you mentioned and others that we may have missed. A lot of work goes into that production, but in the planning of really changing your mindset and your thinking around a digital platform and how we're going to present that information in an exciting way to our incoming families. So thank you again.
You're welcome.
Thank you so much. All right, we'll continue our meeting with a report from Superintendent Dr. Menaville.
Thank you, President Garcia, Vice President Baraza, and members of the board. February is Black History Month, and as a district, we are proud to recognize and celebrate the contributions African Americans have made in our country. We are fortunate in Tempe Union High School District in that we are a diverse community and an inclusive community of students, employees, and families. Our community has a diverse voice, diverse in ethnicity, diverse in culture and languages, diverse in our socioeconomics, and diverse in our thought. We recognize the importance for us to continue a commitment to our shared values that diversity is a strength and an asset for us, in which every individual has equal human value, and that a safe environment and peaceful discussions are essential to learning and societal progress. This is what makes us TUHSD strong. I would like to bring special attention to the virtual symposium titled Together We Can End Racism. This opportunity is a result from our partnership with Mesa Community College. There will be 7 virtual sessions offered beginning tomorrow, February 4th. I'm going to ask that you visit our website for registration information and take advantage of this really tremendous opportunity, and you'll look at the topics. There's a lot to learn there. I would also like to recognize several students who were recently honored as recipients of the 23rd Annual Tempe MLK Diversity Awards. Margot and Maddie McArdle. Margot is a DV student, and Maddie attends one of the sister feeder schools. I'm not sure which one, but but she's going to be coming to one of our schools, and that would be DV. But they're sisters, and who volunteer their time to help their schools become safer and more equitable. Margot and Maddie are in middle school and high school, like I mentioned, and help facilitate after-school programming each week for youths experiencing social inequality. The two take part in a podcast produced by Peer Solutions called The Peer Pod, which discusses ending oppression, silence, and normalized harm. That is incredible. So I intend on listening to their Peer Pod. Let this old guy do that with them. And then the other candidate I want to mention that's a Tempe Union alumni, and that's Jason Hodge. That's a familiar last name to some of you, but Jason is a graduate of McClintock High and obviously the son of our very own Burdetta Hodge, but an NYU student with his sights set on law school. Jason Hodge can be found volunteering at the Boys and Girls Club, Ladmo branch, working with national groups on civic and leadership opportunities for young Black men, or working on local food drives during the pandemic to ensure vulnerable youth don't go hungry. Understanding that systemic change comes from active and visible participation by members of the community, Jason has been active in Black Lives Matter, has volunteered with Our Voice, Our Vote, Black Men's Initiative, and My Brother's Keeper. And we couldn't be more proud of our Jason and our Margot, and soon to be Maddie, coming to DV as well. And so it's just we have to be mindful of the positive things that our students have done, our past students, and that our current students are continuing to do, because they do care about their peers, their community, and their world, and we all have a part in that. So thank you, and that is my superintendent's report.
Thank you so much, Dr. Mendeville. Now is the time for public comment. Dr. Mendeville, I know we have items for later in the agenda, but are there any that are not part of any agenda item?
We have, we have one email for this item. Dr. Wilson, will you take this part? There you are. Mute. There you go.
Sorry about that. Thank you, Dr. Mendeville, President Garcia, members of the governing board. This is the time for the public to comment. Members of the governing board may not discuss items that are not on the agenda. Action taken as a result of public comment will be limited to directing staff to study the matter or scheduling the matter for further consideration and decision at a later date. Public comment concerning a specific agenda item is heard at the time that item is addressed by the governing board. The public meeting notice provides the method by which the public may submit comment and have their comment read into the record. Public comment for tonight's meeting was accepted from 1 p.m. Monday, February 1st until 3 p.m. today. One email was received regarding a topic that is not on this meeting agenda. It will be read at this time. Emails for agenda item L1, in-person instruction, will be read when that item is discussed by the board. Board members have received a copy of this public comment from Susan Woods, Corona del Sol Guidance Assistant. Superintendent Dr. Mendeville and board members. First, I want to thank you for all you have done in the past 9 months to protect staff and students from COVID. It has been a challenging time for everyone. I'm writing to the board to ask you to consider waiving the TUHSD policy of online transfer credits, at least for this current school year. The policy states, being with the 2017-2018 school year, online courses from non-TUHSD accredited high schools are accepted by TUHSD as elective credit only. This year, TUHSD has lost many students and their ADM to other schools in the Valley, many of which are online. I think the question that needs to be asked is, do we want these students and their ADM back? For example, Corona had 20 students withdraw to go to ASU Digital Prep. We are now having to tell these students that they can return to Tempe Union, but they will need to take the TUHSD semester finals for all their core fine art and CTE classes or receive only elective credit for them. For many of these students, that means they will be taking 10 finals before they can receive TUHSD credit. We have had students leave to go to ASU Digital Prep, Chandler Online, Glendale Online, Scottsdale Online, K-12 Academy, and Primavera, to name a few. These students are attending these accredited high schools and taking classes online just like our students are. I understand why the policy was introduced 4 years ago. We were losing ADM because students were taking a core class at Primavera to replace or make up grades during the school year. By offering Tempe Union online free this year to students, we have had very few students even take electives at Primavera. By waiving this policy, at least for this current year, it would give a good incentive for students to return to their home school next year without the concern of either losing credit or repeating all their core classes. The second issue I would like to ask board to consider would be raising the pay rate to teachers for teaching summer school and intersessions. Currently, the pay rate is $25 an hour. This has not changed for at least 10 years. In 2010, the minimum wage was $7.25 an hour. At that time, $25 an hour was a great incentive for teachers to work and receive extra pay. Now the minimum wage is $12.15. The current 25 seems much less of a motivator. Since the plan appears to potentially increase summer academy classes this year, hiring additional teachers could be easier with a higher pay rate. Thank you for your time and consideration in discussing these two issues in the future. Susan Woods. That concludes public comment for that section.
Thank you so much, Dr. Wilson, Dr. Mendeville. We can look into that matter. All right, at this time, we will continue with the order of business. Next is our consent agenda. I move approval of consent agenda items I1 through I10. May I have a second?
Mr. President, I second.
Thank you so much. All in favor, say aye.
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 Any opposed? The motion passes 5-0. Thank you so much. Next, we have the public hearing on revision number 2 of the 2020-21 expenditure budget. Dr. Mendeville.
Thank you. And as is required by law, we have to open this up for public comment, and we do not have public comment on this item, right?
Thank you so much. Then we'll move on to business services items. The first is revision number 2 of the 2020-21 expenditure budget. Mr. Carranza is going to present information about the changes, and I think alongside Diane Yeomans.
Now, just because I don't see Mr. Carranza doesn't mean he's not out there virtually. So
I'm here.
I figured you were there. I can't see you, but I know you're out there. So there you are, Roland.
Okay.
Good to see you. We are ready for the presentation.
Okay, great. Good evening, President Garcia, Vice President Barraza, members of the board, Superintendent Mendeville, staff and community. So we are revising our budget tonight. If you recall, we revised our budget back in December, revision number 1 of our budget. And so this is the second revision. Typically, we wait until May to make a revision, the final revision for the school year. We're bringing this revision to you tonight because we received the adjustment for distance learning, which you will see on this summary is a just under $2.8 million adjustment, and that was part of the governor's executive order 2020-44. And so that's the impact to our budget capacity based on the amount of time that was identified in the fall as far as distance learning based on the information that we had available back in the fall. And so the other adjustment to the budget, the current year budget, is from a continued decline to our ADM from real-time funding. And through January 4th, there's an additional decrease of just under $1.9 million to adjust for ADM that was earned through that time. So it was a decline. And so that decline represents from the time that we adopted the budget at the beginning of the year in July. This additional 1.9 million is about a 2.3% decline in our ADM. The adjustment that was made in December was about 2.7 million. And I'm saying this for the benefit of the new board members. And so at that time in December, that decline in ADM was about 2.9%. So combined, the adjustments to date with revision number 2 for our ADM is a total of 5.2% ADM funding drops since the beginning of the school year. So the adjustment for those 2 items, which is the main reason we're doing this adjustment, is a decrease of about a little over $4.6 million to our budget capacity in M&O. So that's a big number, and but we are fortunate that we have planned building up our budget carryover. And as you well know, in our monthly financials that go to the governing board, we do have an indicator that we project how much carryover we have. And the January projected carryover was approximately 12.2 million, a little over 12.2 million. So this reduction of a little over 4.6 million is going to decrease our carryover in the current year. So that's where we're going to be making up the ground. That will put us at approximately 7.6 million in carryover capacity, approximately, instead of the 12. Our target, again, for the benefit of new board members, our target carryover is about 8%. And we kind of shows 8% just because that represents 1 month of reserves. So if you take 1 divided by 12, it's 8.33%. So we've always wanted to at least have a minimum carryover in M&O of about a month, so that we can have the capacity to be able to adjust for changes in our funding, just like these that we're making tonight, without impacting the day-to-day operations. Obviously, we still have to address it in the ongoing budget, but this is how we're addressing it in the current year budget. The other adjustment is happening to our unrestricted capital budget limit, a very minor adjustment. We picked up 4,562 to our district additional assistance. That is a figure that's in continual adjustment as we adjust that figure to ADE. So those two areas are the summary of the changes to our budget limits, and I'll open it up to any questions that anybody might have.
Board members, any questions? Vice President Barraza.
Yes, thank you for your presentation, Roland. I really appreciate it, and it's good to see you.
Yes,
I'm just curious, we're at 8% in terms of the reserves. We've been in the past closer towards 10 for rainy day purposes. Is this one of those rainy day moments that we're utilizing to make sure we're still keeping things afloat? I know the district has been very responsible in terms of fiscal management, so I just wanted to kind of get your opinion and what it all means, if anything, if nothing at all, if this is just an adjustment.
Yes, you are correct. We have been planning for declining enrollment. I know that at some point we bring a demographer's report to the board to share what our demographer projects for future years. And the picture is that the numbers that are coming up from our feeder schools is dropping. And so we have been purposely and strategically, wherever we can during budget development and areas where we achieve savings, we do try to build up the reserves for just this situation. And so we're fortunate that we have the ability to adjust it for the current year. But we still have to remember that the ground that we have lost, the 5.2% drop in ADM, is something that has to be addressed in the budget that we bring for you for the following school year. So we're good for this year, but for next year, the drop in ADM numbers is something that will need to be considered in the development of next year's budget.
Thank you so much. Member Hodge.
Thank you. Thank you so much, Roland. You always do a phenomenal job every time you explain the budget. I just want to ask, have you heard that the ADM that I've heard from down there at the State House, that they're looking to refund it? That might be one of the budget things that they're talking about giving us a refund on. Have you heard about that? And I know that'll affect just this budget. But can you explain if you heard anything on that part too?
Yes, we are aware that at the legislature are discussing that with state funds might be available to possibly, if approved by the legislature and the governor, that there is a possibility that they might fund the distance learning reductions statewide. We don't know that hasn't been approved at this point, but it's in discussions at the state level. I will say that this adjustment, it's worded on purpose, preliminary distance learning adjustment. So the adjustment is based on the percent that we reported in the fall. I can tell you that as of today, that percent is higher. So our percentage has grown. And depending on the decisions that are made for the remaining 68 days to get to the end of the current instructional school year, the state will ask us to report what was your final actual distance learning percentage for the entire school year, and they will make a final adjustment to reflect what actually happened for the school year. So this is preliminary. So yes, it would be great if the state would come back and fund whatever that number might end up being, the final number. But we also need to be prepared that this number might go up a little bit more. Maybe if we do more in person, we might be able to recover some and be able to gain some of it back. It's hard to say where it's going to end up, but we still have approximately 7.6 million in current year carryover. So we'll be able to adjust for anything in the current year. It's just what happens in the following year. And so obviously, if the state does come through, that will maybe help us build back up the reserve and still have to address the declining ADM in the future year. So if it comes through, great. But if it doesn't, we can still adjust for things in the current year.
Thank you so much. Vice President Barraza, do you have another question?
Yes, I do. Thank you, Roland. I just want to know, I know that CTE courses affect ADM in various ways, and one of them being that students, attend 2 years in CTE, and we get, I believe, a specific amount in terms of the ADM. Do we know what that means for next year, our budget? Anything in terms of how courses in person will affect ADM now, moving into a 5-day phase at some point? Would it affect our budget now, our current budget? How about that? Let's stick to that.
Yes, whatever decisions are made as far as the amount of days that are going to be virtual versus in person is going to continue to impact that distance learning adjustment. And it could, by the time the end of the school year, it could go up or it could come back down. It's hard to predict. It's going to be based on whatever the actual numbers are after the last day of school.
I want to add to that that before just for clarification's sake, because those who are listening out there, that the demographers have demonstrated that we are in decline for all the reasons that Mr. Carranza have stated. We have an aging neighborhoods, and people love their homes and they're not moving out. And Tempe is becoming increasingly more costly to live in, and so there's all those factors with that. But I, to your point, Mr. Carranza, too, we've been very strategic in our planning and thinking long term, because that's with the help of this information from a demographer, we can make those sound decisions. I am hopeful again that with the state Senate proposing initially that they would fund the extra 5%, that will come through, because that's a strong committee, and the legislature appears to be taking that on, and there's a bill out there right now, but I'm hopeful that we'll be able to get that. However, you're correct in saying that we have to make those adjustments accordingly to next year's fiscal 22 budget, and therein lies the challenges. And so next board meeting, we will be sharing some pretty detailed information so that you have a better picture along the way as we begin to develop the budget for the fiscal year 22.
All right, thank you. Mr. Montero?
Yes, Vice President Barraza already asked a question that's along similar lines. So I just wanted to quickly thank Roland and Mrs. Muehlman and your department for all the work that goes behind this. I know we only see a fraction of all the work that goes into this, so I just wanted to say thank you.
Thank you so much, Roland and Diane, for all of your work. We really appreciate it. At this time, I move approval if there aren't any other questions, board members. All right, at this time, I move approval of revision number 2 of the 2020-2021 expenditure budget as presented. May I have a second?
Mr. President, I second.
Thank you so much. All those in favor say aye.
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 Any opposed? The ayes have it 5-0. The motion passes. Board members, we need to sign the budget cover page. Mr. Carranza will be in touch with you to make arrangements to get the signatures either tomorrow or Friday. All right. Next, we have the contract award for architect and engineering services for turf fields. Dr. Mendeville.
Thank you, President Garcia and Vice President Barraza and members of the board. Mr. McDonald might be able to add something, but I think it's a pretty straightforward business item in that we are very proud that we completed 2 of our turf conversions at Desert Vista and at Tempe High. If you haven't been out there, they are absolutely beautiful. Our students and our teachers will be able to access those fields year-round now instead of short weeks at a time, and our students will be safer on those fields as well. So I know that Desert Vista had one of the rockiest fields out there out of all 6 of our high schools. But what this does for us is that it puts in motion the architectural and engineering consulting for the remaining 4 schools. The plan next year is to have the conversion for Corona del Sol and with McClintock. And then the final 2 schools in fiscal year 23 will be Marcos Deniza and Mountain Point. And so what we're trying to do here is to gather all the architectural design and consulting for all 4 fields and do it all in one swoop. So in the event we are able to expedite the conversions of the remaining 2 fields sooner, then that's the goal too. So we're excited. The consulting firms that we use for Desert Vista and Tempe High did a beautiful job and exceptional work, and I'm grateful that Mr. McDonald has oversight over that because he was on them all the time, and they produced a quality product, and we're very proud of that work.
Dr. Mendeville, thank you very much. Just a couple things. You may remember that the governing board last year around this time actually went ahead and gave this to Lloyd Consulting Group for all 6 fields last year. But when we're talking about artificial turf fields and the technology and the engineering that goes into them, it's always, and the price, of course, it's always a good thing to go out for another RFQ or request of qualifications to kind of see, do we have the right people in place? And so we went through this process again in procurement, and we were able to have 30 people download the solicitation. Out of those, 6 offers were reviewed. We interviewed 3 of them and then did a second request for the top 2 rated vendors. And from there, we went with Lloyd, a consulting group. And funny enough, because they did such a good job, they shined on this interview process as well. And we're going to use them again. So thrilled to continue to work with Lloyd and Bob and Anthony and Zach over there. As Dr. Mendeville said, the next 2 fields, McClintock and Corona. And then, of course, move to Mountain Point and to Marcos Deniza High School after that. So thank you very much, and we appreciate all that we do. We're going to do 2 this summer, and then practically 2 the following summer after that. Thank you.
Great, thank you so much. Board members, any questions? Vice President Barraza.
Yes, Mr. McDonald, I want to thank you again, and please convey all the thanks to everyone involved in the 2 fields and the construction process. I had an opportunity to be able to join you and be able to learn a lot about the process while they were being built. And I feel very comfortable with the bids and the contractors, and I also appreciate the fact that we're looking at the designs as a full for the remaining schools. I think this will speed up the process of getting those done. So thank you so much for being able to think in that type of approach. Also, I really appreciate that each school site is involved in this process, in the design, and in any way they can possibly. I think that's very important. You know, we all feel very much a part of our schools, and you know, there are homes, and they're homes to students as well in the community. And I really appreciate that we're taking the time so that way they can be a part of the process in a very big way. And lastly, I'd just like to say that thank you for making sure that the deadline for those construction projects stayed on time. A lot of people don't realize this, but you really were very strong on making sure that those deadlines were met. We almost were in a position where we were not going to be able to make it for the football games, and you know, the construction crews and you guys all pulled it out and got it done. And it was really great last fall to be able to see those in action. So thank you so much. And please convey the thanks of everyone involved.
Thank you. Yes, it was a good opportunity to get our leaders at the sites onto the interview committee and understand what a request for qualifications and interviews were, and trying to, you know, produce leaders so they have this experience as well. And we're very excited. The next steps would be that we'll do the design build for the next 2 fields. And then in the coming meetings, you'll see construction and turf coming through as well. So thank you.
Thank you so much. Any other board members have any questions or comments for this item? All right, seeing none and hearing none, I move to award the contract for architect and engineering services for turf fields to Lloyd Consulting Group. May I have a second?
President Garcia, I second.
Thank you so much, Vice President Barraza. All those in favor say aye.
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 Any opposed? The ayes have it, 5-0. Thank you so much. The motion passes. Our next item is L1, in-person instruction. Dr. Mendenville.
Thank you, President Garcia and Vice President Barraza, members of the board. We do have a number of public comment on this particular item, and I'm going to hand it over to Dr. Wilson so we can proceed. Thank you.
Thank you, Dr. Mendenville, President Garcia, members of the board. Public comment for this meeting was accepted from 1 p.m. Monday, February 1st until 3 p.m. today. 48 emails were received from 1 p.m. Monday until 3 p.m. today. Per Section C of Governing Board Policy BEDH, public participation at governing board meetings. When there are 31 or more requests to speak, public comment is limited to 1 minute. We received 4 submissions which did not meet the criteria for public comment. These submissions will not be read into the public record. Board members have received a copy of all emails, including the 4 emails that will not be read this evening in their entirety. First public comment is from Don Westing, parent of 2 Corona sophomores. Dr. Mendenville, on 11/18/20, you spoke about the plan to change the delivery model starting January 1st. So teachers didn't have to do both virtual and in-person students at the same time. What has happened with that? Our surrounding districts have been back much more fully as they are putting students first: education, social, emotional, mental. If you say those district decisions don't matter, why? If they were experiencing droves of hospitalizations, deaths, we would have heard about it. We have not. So why not get our kids back to be educated and reduce all the emotionally, mental, social problems that are happening due to the virtual learning? You are tracking and trying to deal with the academic failing situation that is occurring, yet you don't do the easiest, most clear solution: get them back in school. Next public comment is from Rebecca Royalty. Superintendent Mendenville and governing board members, I am a parent of a sophomore at Marcos Deniza. I urge and plead with you to find a way to get the children back in school now. I will not cite studies discussing the detrimental effect that virtual learning is having on the children's social, mental, and emotional health, but I will remind you that almost all the cities surrounding Tempe have figured out a way to get back in the classroom. This makes it appear like Tempe Union does not have the best interests of the children in mind, despite the continual reassurance that you do. In addition, many experts and professional organizations such as the CDC and American Academy of Pediatrics have said that the safest place for children is in school. Going against that advice and the science, again, makes it appear that Tempe Union does not have the best interests of the children in mind. I have said it before and will say it again. I have been so thankful for the time and effort the teachers. Our next public comment is from Amy Beeman. Sometimes a reminder is needed as to what our purpose and our role is in our endeavors to guide us in focusing on our decision-making policies. I think this has become even more apparent during this pandemic, but somehow this focus has been blurred by personal emotions or fears. Perhaps there needs to be a diligent effort to focus on the district's true mission, vision, values, and goals. As a reminder to all decision makers, I am inserting the following. We put students' academic and social emotional needs at the forefront of everything we do. We believe students can learn, and we accept responsibility for their learning. We eliminate barriers to student learning. We believe that all students learn best in a safe and well-maintained learning environment. Unfortunately, I think that TUHSD has neglected to follow their very own purported beliefs. I implore that moving forward, TUHSD keeps this. Our next public comment is from Melanie Trevino. To whom it may concern, I am no stranger to the effects that COVID can have on a family and community, as just before Thanksgiving, we lost a very dear friend to it. Shortly after, our whole family also contracted and recovered from the virus. While I understand that there is no clear-cut answer for how or when to resume daily activities, as they were pre-pandemic, I firmly believe that the future of our country, our youth, are being severely held back educationally and socially by at-home learning. My daughter is a freshman at Desert Vista. We homeschooled her on K-12's platform for 3 years, 6th through 8th, and she excelled. Going into 9th grade, we didn't see that there would be much of an issue with her online learning since she was basically a pro. Such is not the case. She is struggling in every aspect of life, emotionally, academically, socially, and it's 100% due to the online platform she is forced to use through Tempe Union. She has a very low C. Our next public comment is from Amy Jameson. Good afternoon. Our family is writing to again stress the importance of schools opening up. We are watching family and friends pull their children out to go to other districts who are open. We are losing kids not only to suicide, depression, and lack of ability to do online school, but we are now losing them due to enrollment. With already declining enrollment, we should be focused on getting our schools open as soon as possible. We have safety efforts in place and the facilities are ready for students and parents. Other districts are doing the same, but allowing students in. Their numbers are low. Children are attending and following rules as mandated by schools and districts. They are not doing this because they want to. They are doing it because they are desperate for the education they need and deserve. Families are desperate for some normalcy and for their children who are struggling. As members of this community, we believe we should be allowed to Zoom in our own letters, call during board meetings, or send one of our representatives to the board meeting in order to express more than the droning. Next public comment is from Melissa Kruger. I am writing today as a concerned parent of a student at Desert Vista. Many other districts in our area are back to school and or have been in-person school for months. If not for my daughter's love for her friends, I would have pulled her from Tempe Union. You are failing our children. You are allowing the teachers to put themselves first. Our children are suffering. They need their friends. They need socialization. They need to have a routine and somewhere to go. They are losing motivation. They are losing friends. They are losing a desire to work hard. It is extremely difficult for kids to learn in this environment. Their grades are suffering. They are cheating. They are learning nothing. The mental health aspect of all of this is being completely overlooked 2 of my daughter's friends have had to check into in-person mental health aspect of all this being completely all this facilities because this has been the final straw. In-person mental health facilities, is that okay? Open your eyes. Our next public comment is from Stacy Hansen. I'm a parent of a freshman and a junior at Desert Vista High School. It's highly frustrating to see so many other districts in the Phoenix area having their students back to in-person learning and to see it not yet even being entertained in our district. Both of my sons, who are normally very good students, getting A's and B's, are now failing tests and classes miserably in a few subjects. I'm a former teacher myself, so I understand and appreciate teachers' desires to keep themselves and their families healthy. But teachers are essential, and if we were truly following the science, our kids are safest in school and need it badly for their own mental health. I understand the challenges that teachers have had to face to teach virtually, and some are doing a great job and others are not. The classroom management is nearly impossible, and I've sat in on a few classes to see how they're doing, and it's absolutely absurd. I imagine you've now lost a great deal of children disenrolling from our great high school in hopes of getting better virtual education through schools that are better trained to handle it. Next public comment is from Tanya Drew. How many children's lives will it take before you will see that this pandemic lose is not because of a virus? So many children are suffering mentally, not physically, because of COVID. The simple fix would be to open the schools for in-person learning so that our children can be around their peers and taught by a teacher in a classroom. I have heard from my own children that they do not like school anymore because the fun of it has been lost. The social aspect that many kids love of school for is gone. You can't replace the year of social isolation with summer school. We won't know how the damage to our children from this will show in future years. This madness needs to stop, and we need our last semester to be open and remain no matter the numbers. Let those who want to come to school in person have a choice. We know the statistics of children failing has increased. We know our district has lost a lot of students to other schools and districts. We know this will affect students who Next public comment is from Jennifer Clark to the Tempe Union High School District board members. I would ask that you resume in-person learning immediately for all Tempe Union high schools for the following reasons. 1, online learning is isolating our children and leading to decreased mental health as well as lower academic success. 2, other districts and schools throughout our area offer in-person. This puts all TUHSD students at a stark disadvantage as they fall further behind their peers. This will make them less competitive for college acceptance and scholarships, and well as lower overall testing scores once testing resumes. 3, TUHSD, once known as a high-achieving district, will no longer have that distinction, leading families to seek alternatives for their children's education. The district will suffer for years to come as a result. Please do the right thing and open our schools. Our children's futures depend on it. Next public comment is from Michelle Coble. Good afternoon. I appreciate the district reaching out for teacher feedback about a return to in-person instruction after spring break. As I filled out the survey, there were some questions I had which were not addressed in the survey and as a result may have skewed my answers. 1, from the survey, I was unclear if the return to 5 days of in-person instruction meant an end to virtual learning. If this were the case, I would be in favor of return to in-person as teachers would be vaccinated. 2, if this means, however, that I would be tasked with teaching both online and virtually with no asynchronous day on Wednesday, I am vehemently opposed. 3, I have 3 preps, and while I have a wealth of material for in-person instruction, I'm spending a great deal of time reformatting all content for online instruction. Even with the asynchronous day this whole school year, I give up 1 full weekend day to work on material. Asynchronous day allows me to catch up with grading. Next public comment is from Leslie Clock. Hello, TUHSD board members. I didn't realize that as a TUHSD parent and as a nurse practitioner in the community, I wanted to weigh in and voice my opinion that our kids should be attending school in person. During the last board meeting, I heard many parents emailing in and asking you to follow the science. Incidentally, the science does not support that COVID-19 is widely spread in schools, especially when mitigation strategies are in place. I'm including links to reputable sources that indicate the same. On January 29th, the CDC reported a study from Wisconsin which found that out of the 191 COVID cases found in schools studied, 7 were spread in school, while the remainder of cases occurred and spread outside of school. Of those 7 cases, all were students, none were staff. The study included a period of 3 months. On January 26th, the Journal of the American Medical Association published an article which cited a North Carolina study that found that of the 805 COVID-19 cases, our next public comment is from Carly Blodgett. Dear esteemed members of the board, as a teacher within Tempe Union, I want to express my gratitude for your efforts to keep staff and students safe this school year. The decisions made have not been easy, but they are appreciated. The board will soon consider how we should again reopen our schools. I ask that our district implement our hybrid model in its reopening plans. Although the majority of Tempe Union staff has thankfully received the first dose of the vaccine, many of our families do not yet have access to this vaccine. I want to ensure our vulnerable student populations have the option to continue remote learning without disrupting their class schedules. Among my 5 English classes, 73 students, 46% of the total chose to remain entirely virtual when we did hybrid learning in Q2, a time when our metrics indicated community spread was lower than it is now. Although I am vaccinated and more comfortable teaching in person again, I feel that I must advocate for these students. I want us to stay together until the end of the year without anyone being forced to potentially compromise the health of. Our next public comment is from Paul Malley, to whom it may concern. This is in regards for the meeting on Wednesday to discuss students returning back to school in Tempe Union High School District. I'm in favor for students returning back to school at Desert Vista. Studies show that the students are safe at school and it would benefit them with their learning, their mental health, person-to-person socializing, etc. I don't understand why the schools in Chandler Unified District are able to return and we aren't. Doesn't make any sense to me. Plus, this is my son Michael's senior year. Please make the right decision for students to return back to school. Thank you. Nora Malley. Next public comment is from Danielle Paulette. Good evening, Superintendent Mendeville and governing board members. My name is Danielle Paulette. I have a senior and a freshman at Mountain Point and 2 children who attended Pueblo Middle School. I'd like to thank the district for being consistent and continuing to follow the health and safety metrics. Though I'm grateful for TUHSD's commitment to safety, I'm very interested in a detailed, data-oriented superintendent's report that would feature all the ways TUHSD has been striving to make virtual learning equitable for students with special needs, students with working parents, and students from traditionally underserved communities. What changes have been made to the ways we traditionally measure the success of teachers and students? Have teachers still had the opportunity to participate in professional development to more effectively serve their students in need of extra social and emotional support during these unprecedented times? Regarding vaccines, is there someone at the district level or at each school site dedicated to coordinating vaccine distribution? Are other school staff? Next public comment is from Marish Farley. Hello, prestigious board members. In the TUHSD community, I wear many hats. I'm a parent of a Tempe Union parent. I have children who have adopted to this program accordingly, but are sad and disenfranchised by their lack of opportunity to socialize and engage with classroom activities and miss them relationships with their peers. I'm a resident of Ahwatukee. I miss seeing the buses around town, children on the playground, museums, and sports activities. It's almost as if the children have disappeared in our community and in hiding. Lastly, I'm a teacher at Mount Point High School and a member of the site advisor of TSEA. My skill and passion of career and technical education has turned into mental health counselor, academic interventionist, truancy specialist, technical support, actress, communication extraordinaire. None of these are my specialties, but wear them with pride. My classroom failure rate has tripled, and all the grade dropping curving. Next public comment is from Kathy Nicholson. Dear board members and Superintendent Mendeville, what a year this has been. I am a new teacher to Tempe Union this year, but not new to teaching. COVID and the virtual format has forced teachers to be more creative and resourceful than ever, striving for ways to effectively deliver instruction to students who in some cases were in other countries. While I would always rather teach students in my classroom than teach students from my dining room table, I'm grateful to work in a district so committed to protecting the safety of all stakeholders, students, teachers, and staff alike. Thank you for keeping us virtual during the times of the highest community spread. I believe your decision to keep Tempe Union virtual while Arizona was a worldwide COVID hotspot and healthcare resources were scarce saved lives. As cases are now declining, the board and superintendent will likely consider the appropriate timing and format to return to the classroom. There will be families who may elect to continue to have their child learn at home due to any number of health concerns. Next public comment is from Patrick McChesney. To the TUHSD Governing Board, Dr. Mendeville, and TUHSD Executive Team, my name is Patrick McChesney, and I'm the Theater Director at Marcos Teniza High School. I want to take this moment to thank you for making all the hard decisions this year during the pandemic and standing up to the harsh bullies, critics, in order to protect our students, staff, and families. I know that more decisions need to be made about returning to the classroom, and I would hope that metrics remain at the center of that conversation. While I appreciate the short survey sent out for TUHSD staff input, I am concerned that the response choices do not adequately address my main concerns. Although I answered somewhat comfortable for both, I feel I should provide additional feedback. 1, metrics. I truly hope that the decision to return to in-person instruction will not be based solely on a date or whether employees feel comfortable with returning to work, although I appreciate being asked. I believe in order to remain consistent with guidelines that were created and implemented. Next public comment, Jamie Allison. Board members, my name is Jamie Allison, and I have a freshman who is enrolled at Corona del Sol High School. I write this evening to share my support for resuming in-person education for our Tempe Union students as quickly and safely as possible. My freshman son continues to struggle academically and socially in the online environment. Learning is strained, and his results and grades rely heavily on self-discipline and self-motivation, 2 qualities greatly lacking in young and developing minds. He is frustrated, and he no doubt is frustrating to his teachers. I continue to be required to work full-time outside of the house during this pandemic and feel terrible and torn about the trade-offs I'm forced to make. Since March, and more every day in 2021, most businesses and industries have figured out ways to resume operations at admirable levels, being safe while remaining committed to their missions, their customers and services, and roles within society. Bookstores, auto repair shops, retail shopping, vet clinics, salon, dentists, and on, every industry. Next public comment is from Allison Irvin. Hello, I know that there is a board meeting taking place and I wanted to give my input as a parent. There are so many factors to why I believe our schools need to be opened. One being that students are not receiving the proper education that they need and they're falling behind in so many areas. I hear so many stories from my student and other parents how this is affecting our students' mental health. There are many schools that are open in the Valley and doing well. Why can't we model after what they've done successfully? Our family is very disappointed in this district and how they've handled all of this. I know it's difficult, but the communication has been very poor. We will most likely not be returning next year because of it. Unfortunately, our schools will suffer more because of this decision in the future. Hoping you decide to open up our students. Thank you. Next public comment is from Jennifer Wren. Hello, governing board members, President Garcia, and Superintendent Mendeville. My name is Jennifer Wren. I'm a Kyrene parent and resident. I want to thank you for staying true to science regarding the COVID dashboard and keeping students virtual at this time. I fully appreciate that the governing board and superintendent makes decisions based on the whole of the student body and not a few. I fully appreciate that the governing board and superintendent makes decisions based on the whole of their employees and not a few. These are unprecedented times, once in a lifetime event. It's the kind of event that requires all of us to step outside of the status quo. Status quo says kids need to be in school. Kids are falling behind. Our kids are sad and depressed and losing academic ground, so we must get back to normal. Of course, these are real concerns, but in the end, our students will be fine. They are resilient. The Tempe Union staff is resilient. When we pause to think about the whole community, this is the stance we must take so that when things are back to normal, we have a kind of unity required to move forward. Next public comment is from Catherine O'Leary, to whom it may concern. I'm writing the board in an effort to urge you to consider the health and well-being of all families as it relates to in-person learning. A little background. I am now a single mom of a 12-year-old and a 16-year-old. Despite taking precautions and endeavoring to maintain a small bubble, my husband and my children's father contracted COVID-19 and died in early December. Like many families, we never believed this could touch us so personally and so profoundly. We are inundated online and on social media with taunts from anti-maskers and anti-vaxxers in our community who mock those of us who choose respectfully to maintain a bubble and don masks for the safety of others. While I'm grateful teachers in our community have been vaccinated, it seems that it will take some time for the greater portion of our community to be vaccinated. Those children who come from families that don't maintain social distance and don masks put other children at risk of bringing virus home to high-risk and non-vaccinated families. Next public comment is from Heather Walgren. Hello, board. My son is a junior at Desert Vista. We moved to Chandler last August, but our son chose to stay with his friends at DV. We are surrounded by people that have their kids in session where the students can be in the environment they are supposed to be in. This has gone on long enough. The school should be the hub for the students, and it helps them find their identity, which affects them for years to come. My son is bored. He doesn't see his friends. Do you realize the way this is damaging the children? How does it affect their college years and beyond? With so many options out there for private schools, open enrollment, and public schools, tons of online options, I would imagine you will want to push to get the kids back before we all start pulling out of this district. It's obviously the next step for our family if this nonsense continues. Can't we take the safety steps and let people decide if they want to return? Next public comment is from Tricia Fuller. Hello to all. Please hear us parents who support in-person school. We have already written Superintendent Mendeville and received a positive note the other day. Thank you. I have a senior and a freshman. Please consider reopening ASAP. As you have heard recently, it has become increasingly clear from CDC findings kids K through 12 are safer at school. My senior needs closure from high school. He feels he's only been to high school 2.5 years. My freshman and honor student is increasingly deteriorating mentally. On Monday last week, she screamed, "I hate school." I have never heard her say that. My fighter's grades increased 19 to 20% in the quarter of hybrid. If my home's student with lots of family support is declining mentally, I am certain there are kids who must be as well and may not have that support. We just traveled to South Carolina for a well-managed. Next public comment is from Pam McCardle. Dear President Garcia, board members, and Dr. Mendeville, I am a parent of a student in both the Tempe Union High and Kyrene school districts. Thank you for following the science and putting the safety of our students, Tempe Union employees, and community first. We need to stay with virtual learning until our rate of community spread has been dramatically decreased. If we listen to what our medical doctors and scientists are advising us, we can get through this and our kids will learn lifelong skills that will benefit them. Although the numbers are coming down, it is still not the time for our students and staff to return to in-person classes. I am hopeful that with the vaccine available and after we get our staff vaccinated, we can move forward with safe reopening plans. We will need to provide extra help to the students that are struggling, and work to make changes in our education systems that this pandemic has made glaringly obvious. All our Tempe Union students need the tools to succeed. Thank you. Next public comment is from Lori Bastian. Dear Governing Board and Superintendent Mendeville, everyone is quoting experts and data to support whatever view that individual holds regarding children being in schools. Recently, even more experts have said the safest place for kids is in school. However, those that want to keep kids home fire back with only if community spread is low. The low community spread qualifier is actually an outdated fallacy. Here are the facts. CDC officials said in a study published last Tuesday that schools should resume in-person learning as soon as possible if social distancing and masks are properly enforced. Anthony Fauci said Thursday it's less likely for a child to get infected in the school setting than if they were just in the community. He states no qualifier about whether there is high community spread or not. When asked about returning to in-person learning, Arizona's Health Services Director, Dr. Kara Christ, said last Wednesday, "I'm a huge advocate for kids." Next public comment is from Kelly Roble. Dear Tempe Union High School District Board members, I have a daughter, niece, and nephew who attend Corona del Sol High School. I would like to ask for you to please put a plan in place to return our children to in-person learning. I have friends and family in all of the neighboring districts, and all of them have been able to come up with a plan to put all kids back in school. Those districts are in the same state as far as metrics, yet they give their parents the choice of whether or not to have their children attend school in person. It makes absolutely no sense to not follow the science and at least give us parents the option of in-person learning, just like the other districts around us are. I go to work every day. My family goes into work every day. We are all doing our part to keep the world turning. Why is this not the same with teachers? All parents are asking for is the choice to do what we feel is best for our child. I come from a family of teachers, and we have many friends who are teachers, and all of them are in-person teaching right now. Next public comment is from Talia Remmer. To Dr. Mendeville and the TUHSD Governing Board executive team, I am Mrs. Talia Remmer, the dance director and a health teacher at Marcos Deniza. I want to thank you all for your time and dedication this year in making the right choices for our students, staff, and families during these difficult times. As decisions are being made for the rest of the school year, I want to share some thoughts based on my perspective as a classroom teacher, as well as a mother, wife, daughter, granddaughter, and community member. I would love to see us move towards in-person experiences with our students, but I do have some concerns with jumping directly into a full 5-day in-person model without any sort of transition period. My main concern with the 5-day schedule would be the loss of asynchronous Wednesdays. In addition to increased instructional planning time needed this year, teachers are using this as valuable time to provide meaningful feedback to our students and to open lines of communication between teachers, support staff, students, and families to help our students, especially those who are struggling. Next public comment is from Sherry Erskine. To the board members, my name is Sherry Erskine, and I currently have an 11th grader and an 8th grader still in school. I have had 2 children graduate from Corona del Sol, and up until this point have loved Tempe Union High School District. We moved to Chandler from Gilbert back in 2005 and had read about Tempe's fabulous reputation and looked forward to my children being involved with such a great district. Right now, I could not regret my decision more to have decided to move. I love where I live. I love the community I'm raising my children in and the people I have been fortunate to meet and the teachers, students we have been fortunate to be associated with. I am so beyond confused as to why our kids are not in school, and I'm looking for answers. I watched a Good Morning America segment where they talked about this very thing. Everything is pointing in the direction of get kids back in school. I'm writing today. Next public comment is from Lori Sherman. Dear Governing Board, Thank you for all you're doing for our students. I am a parent of a MPHS junior. I would like to see our students return to in-person school. Based on the content of previous governing board meetings, there seems to be significant focus on the number of students that are failing and the guardrails the district is putting in place to help keep these students on track for credit recovery. I think this is necessary given the high number of students with failing grades. In addition to this effort, I would also like there to be more transparency into the rigor of education for all students. For each course, is the entire curriculum being presented to the students? Are the students completing the assignments so that they are able to master the material? If items are being trimmed from the curriculum, either material or assignments, I think it is critical to provide transparency to the students and parents so we can make decisions on coursework for next year. As an example, if all the pre-calculus material is not being mastered, what needs to happen for students to proceed? Next public comment is from Danielle Brake. I have 3 children at Corona del Sol that are all suffering with the online platform. The emails we received about school reopening are vague and often conflict with the expert opinions. Currently, the CDC, the AZ Department of Health, and Dr. Fauci state the safest place for children to be is in school. The CDC also released today that vaccinating teachers is not required for a safe reopening. We were promised at the beginning of the school year that in-person options would be available to those who want it. The decline in grades and mental health that I've seen in my own children has been incredibly frustrating. I want answers and actual information, including a date for reopening the schools. Surrounding districts have already opened. We moved to this district because of the quality of schools here, and I feel like that was a tremendous mistake. I've already looked into putting them in private school, which has remained open the entire time, but can't afford. Next public comment is from Lori A. Rizzo. Dear board members, I am the mother of a Corona del Sol freshman. Our decision to attend CDS was based on its excellence in teaching and learning. Thank you for your time and consideration of my concerns. Please open the schools. My son is failing and losing focus. He is experiencing extreme fatigue associated with depression. We are doing our part at home as a family. I wouldn't be reaching out if I felt the schools were doing part in working in partnership. Please open the schools. The decision to keep the schools closed is providing advantages for the adults at the expense of the children. The single issue focus is actually detrimental to our community as a whole and to the future achievement of our students. The decision to keep schools closed is halting progress, creating barriers to learning, putting the student last, ensures that all students do not receive the education necessary for success in college, career, and life as viable members. Our next public comment is from Jill Osborne, Tempe High teacher. The light at the end of the tunnel is starting to glow. I can't wait to actually be in the room with students. I do have concerns as I have a friend with COVID who is unconscious and on a breathing machine in the hospital. Do we have plans in place to help with depression for students who learn they are asymptomatic spreaders and that someone they sat next to in class dies of COVID? Can we cope with the huge amount of students, faculty coming on to campus to take temperatures and health screening checks? Do we have a plan in place for students, families who decide that they do not want to come back to school? Is it a requirement for all faculty members to have a vaccine so that we are all more protected? Do we have plans in place when we learn someone has tested positive in our school? How will we contract trace? No doubt there are many more questions regarding safely coming back on campus. While I'm excited to teach in person, our next public comment is from Michael Jim. I'm a parent, to whom it may concern, I am a parent of a freshman and junior attending Desert Vista High School. I realize this year has been challenging and a very dynamic environment. But at the same time, it is frustrating to see other school districts carrying on in person while Tempe is still online. I appreciate the teachers' desire to keep themselves and their families healthy, but feel that with safety standards put in place, in-person schooling can be done safely. I hope the school board takes many factors into account and will reconsider opening up the schools again for the remainder of the semester. The benefits of the social interaction and in-person schooling are such a huge factor in our students' success for the ongoing year. Our next public comment is from Jennifer Bart. Dear governing board members and Superintendent Mendeville, thank you for the decisions you have made thus far regarding the pandemic, and thank you for following the metrics and the science when making these decisions. As you begin to plan the return to school, I ask that you consider a few important points. First, I seem to recall being told at a study session in the fall that we would never just return to campus 5 days a week with all students without phasing it in. What happened to that plan? Has a decision been made to change directions and abandon that plan? Second, please do not take away asynchronous Wednesdays. Just because we go back in person, that doesn't mean all of our students will be coming to school. Many will want to remain online, and this means teachers will be planning for both in-person and fully online instruction. Additionally, many teachers will still want to utilize teleconferencing for one-to-one tutoring sessions with students, and asynchronous days provide the perfect opportunity for this. Our next public comment is from Deborah Bigham, parent of CDS student. COVID has brought a whirlwind of emotions to our lives. Many people have lost loved ones this year. My prayers are with them. COVID has also put the spotlight on the school board, and it has been extremely disappointing. These meetings seem to be an hour and a half of everyone patting their own backs and 3 minutes spent on voting on items of business that are hardly explained to the public. As Dr. McDonald reacts to the latest COVID numbers, he spends the data to conform to your agenda. It is clear no forethought has been made in the thousands of students who are suffering because of your decisions. Why are you not making decisions best for our kids and what the parents want? History will not be good to you and will show that you were wrong to keep kids home. Do not be surprised if many lawsuits are headed your way for this very reason. Please have the kids return to school now. Please do what over 60% of families in your district want. Next public comment is from Nash Bigham. I go to Apprende Middle School. I have been told that Kyrene and Tempe School District make decisions together. So if you decide to return, then Kyrene will return. I am begging you to please have us return to school. I don't like learning from my computer, and I'm not doing well. I have tried and nothing is working. When this first happened, I thought, cool, a long spring break, but I hate it now. Everyone on my baseball team in Gilbert has returned to school and they love it. I have asked my mom if we can move. My cousins have moved to private school, so I asked my mom if we could do that. I feel like everyone is at school but me. I got COVID over Christmas and it wasn't fun, but I thought for sure I was supposed to die. Why else would we stay home from school because of COVID? They way our community has acted. I thought getting COVID would be a lot worse. Just let us go back, please. Next public comment is from Erin Thompson. Hello, wonderful board members. First of all, I want to thank you for your continued support throughout this crazy school year. I know you've been on the receiving end of some hurtful actions and comments, which is quite sad to see. That said, I want you to know that I have appreciated every step you've taken to ensure the safety of staff and students. As badly as I want to return to the classroom full time, I have been able to rest easy knowing that you have our safety in mind with all of your decisions. It has been brought to our attention that you will be discussing our return to school at tonight's study session. Please know that the thought of seeing my students and being back in my classroom overfills me with joy. However, I do have a few concerns. First of all, I'm concerned about the current plan to return 5 full days a week. Why are we eliminating asynchronous Wednesday? This has been a day that has provided a teacher with necessary time to build and recreate our curriculum to meet the needs. Next public comment is from Jeff Bigham. Dear board members, it is time to return to learning in person. Having my 3 children home during remote learning has put an extreme amount of pressure on our family. Kids do not enjoy sitting behind a computer for several hours. They are not learning, and now they are refusing to learn. My eldest son has stated, I just can't do this anymore. I can't stand learning from a laptop. I hate it, and I don't even care about my grades. This particular sin has always had A's and B's and enjoyed learning. Conversely, he currently has D's and he doesn't even care. My wife and I have tried to help him, told him it is temporary and to keep focused. These conversations of encouragement usually end up in a huge argument with all of us depressed. Your decision to keep kids home in hopes of saving lives from COVID is actually destroying our lives and many other families as well. Next public comment is from Dawn Jansen, parent of a Tempe Union student. Dear Tempe Union Governing Board, I understand that we are in unprecedented times with the COVID-19 pandemic, and we are all doing our best to mitigate the spread of the virus and keep our students safe. I have respect for the teachers and administrators that are doing their best to teach the students during this time. At the beginning of this school year, I expressed my concerns to the board with the online and hybrid models that were proposed at that time. We are now almost a year into the pandemic, and Tempe Union students have been in the classroom at most 10 days in the past year. It is now time to make a plan for our students to return to a 5-day learning model. During the few weeks of the hybrid model, we quickly discovered that was not a solution. This model was not a true in-person model, but online teaching in the classroom. This was not a good model for the students or the teachers. As the parent of a Tempe Union student, next public comment is from Courtney Milanovich, THS teacher and CDS parent. Dear TUHSD School Board, I have some very serious concerns about returning to in-person schooling after spring break. Most importantly, many of my students are currently or have been dealing with COVID. Many have lost loved ones and are dealing with grief and fear of contracting it themselves. Our student population has been severely impacted by the coronavirus and continues to be. I have at least one student on average in my classes who is fighting it currently, or their family members are COVID positive and they are quarantining. Many of the students who have dealt with it have not had their families report it to the school, even though I have encouraged them to do so. Every zip code in Maricopa County remains in the red, and every school district in Maricopa County remains in the red. Metrics are improving, but nowhere close to the levels that would allow us to return to 5 days a week of in-person learning. Other districts who have opened Our next public comment is from Anna Cordova. To the Tempe Union School Board, as a physician and a past and future TUHSD parent, I'm writing today to request that you continue with the virtual learning model in our schools. Rates are indeed dropping in Arizona, likely due to school closures and winter break for school-age children. Now is not the time to reopen. Our hospitals are still at high levels of COVID patients, and ICUs are still close to capacity. I've seen it myself. As an anesthesiologist, I primarily work in the operating room. The preoperative area is the recovery room. The recovery rooms have been converted to ICU beds, And not long ago, our conference rooms were housing patients. Our ICU doctors and nurses are burned out. In addition, the new variants of COVID are showing up in our communities. As I'm sure you are aware, some of these variants are more contagious, more harmful to children, and more lethal. Given this, our current mitigation strategies may not be. Next public comment is from Ismail Osuna. President Garcia and members and Tempe Union board members. In-person learning is up for discussion again, and I understand the board is under a lot of pressure. As a parent, I want Tempe Union to continue with remote learning. As you are all aware, our state leads the country with COVID-19. Ms. Reppy, could you please restart that public comment, please?
Okay.
Thank you. President Garcia and Tempe Union board members. My name is Ismail Osuna, a community member from the town of Guadalupe and a citizen of the Yaqui tribe. I am writing this email to express some concerns about Tempe Union going back into in-person learning. First, I want to thank the board for making the tough decisions to go into remote learning. I support your decision and your leadership. In-person learning is up for discussion again, and I understand the board is under a lot of pressure. As a parent, I want Tempe Union to continue with remote learning. As you are all aware, our state leads the country with COVID-19 cases. In my community of Guadalupe, COVID-19 has hit us hard. I have personally been impacted. I have lost family members and friends due to this pandemic. On Tuesday, we buried another family member. In my community, when someone passes away, they ring the church bell. Lately, they've been ringing the church bell. Next public comment is from Connor Exline, teacher at Marcos Deniza. I would like to begin by thanking Dr. Mendeville, the executive team, and our governing board members for their leadership and level heads throughout this school year. You have been tasked with making unimaginably difficult decisions, but you have proven to us all that your primary interest has always been the safety of our students and our communities. I'm grateful to work for Tempe Union, and I know that many of my colleagues in neighboring districts wish that they felt the same support from their district leadership. Thank you. Given the improving metrics in our district and the rollout of the vaccine, I am cautiously optimistic that we may soon be able to return to our classrooms. However, I am concerned about what our instructional days will look like upon reopening. It is my understanding that although we are returning to a 5-day model, not a hybrid model, students and their families will still have the option to learn virtually. These students that choose to continue virtual learning will require recorded lessons. Our next public comment is from Shan Brown. As you plan for a return to in-person instruction, I'm writing to urge you to allow for schools to have flexibility with the cohort model. My son, who is a junior at Marcos Deniza High School, chose in-person instruction, and most of his classes had very few students attending in person. There was absolutely room to allow students to attend in person 4 days a week. Each school should have the opportunity planned specifically for their site and then utilize larger spaces for classes that have more in-person attendees. Online instruction has been very difficult, and only having the option to attend in person 2 days a week is very discouraging. Our next public comment is from Amanda Wright. Amanda Steele. Hello, Dr. Mendeville, Governing Board President, and board members. I want to start with a heartfelt thank you to every one of you for taking the time to listen to the community, for taking on this role and responsibility during a pandemic, and for taking the precautionary steps put forth by the CDC and the AZDHS. I also want to thank every staff member and teacher, both in person and virtually, for doing their best to provide a school year with some growth during a year where most of us have seen setbacks due to the toxic stress we have all been in for nearing a year. Currently, we have a community of people that want their children back in school. I believe this is a collective statement we can all agree on. The when this will happen is another situation completely. We currently have a new strain that has entered Arizona. We also have MISC, which has taken the lives of a few children in Arizona. Our next public comment is from Teresa Gilchrist. Hi, I teach ceramics at Mountain Point, and I just wanted you to hear my experience. I believe we should go back to school for fourth quarter. I was told I had to spend this afternoon reaching out to failing students and their parents. There are so many right now. Sometimes I don't hear back, but today I have received several emails from students who are telling me that they are really struggling. One student said they wanted to reach out to me, but they were not in the right headspace. It almost made me tear up. Teachers are working now harder than ever trying to reach students. We are coming up with ways to keep the kids engaged. We are sending emails and making phone calls, but kids are still falling behind. I can imagine my teenage self trying to do online learning for almost a year, and I would probably fall off the radar too. I think we have to go back now. I'm thankful for TUHSD setting up opportunities for us to get vaccinated. Because of that, I feel comfortable returning. I would ask that you do not give students a choice. Next public comment is from Rodrigo and Diane Palacios. To President Garcia, TUHSD Board, and Dr. Mendeville. My name is Rodrigo Palacios, and I am a social studies teacher in Tempe High School and the TSEA Vice President. I want to begin by thanking you and the leadership in our district offices for coordinating with Phoenix Union High School District to get our educators vaccinated. As we have seen in news stories, our state is doing its best to get phase 1A and 1B done as quickly as possible. I look forward to getting my second dose later this month. I am hopeful that the second dose can be the corner that so many of us long to round so that we may see our students in the near future. But as science tells us, vaccination from COVID is not the end all be all. We will still need to continue to follow CDC guidelines as they pertain to social distancing and mask wearing. I know we all want to be back in the classroom. I know I do. And we want to give our students and our kids a return to normalcy. But we need to do it following those data. Our final public comment is from Heidi Sauer. Dear School Board and Superintendent, I believe that families wanting in-person education have been very patient and understanding with the delay for Tempe Union in providing that. However, we are very discouraged that we are surrounded by schools in our area, schools across the country, and schools across the world which have been back in person safely for days, weeks, and months. Our students are not receiving the required equal education of their peers in other open districts. Our school district's mission is students first. That needs to happen now, not after more study sessions, excuses, and delays, and certainly not after spring break. Now, when COVID first hit, we did not know the facts and information that we a year later have learned. Our health experts, the CDC, the AAP, Dr. Christ, etc., have stated for months that children are safest in school as children do not seem. That concludes public comment.
Thank you so much, Dr. Wilson. All right, board members, we will continue with this item, but Dr. Mendeville will guide us into what he needs for this specific action. Dr. Mendeville?
Thank you, President Garcia and Vice President Barraza, members of the board. You know, we've heard a lot. We've heard a lot in the presentation. We heard a lot from public comment. And, you know, I always try to look at situations where we can experience a win-win for everybody. And looking at, you know, there's I don't believe that there's a right or wrong answer. We're trying to, all of us collectively, make the best decision that's going to be for our students and our families and our employees, you know. And so balancing that out with some of the decisions that we make tonight and some of the priorities that you share with me, and that what I've heard with regard to criteria, so that we can safely open our campuses back for our students, whether that's 4 days or 5 days. And so I think this is the right time to have that discussion for clarification's sake. And Mr. McDonald's going to stay on board in the event we need to return back to particular slides that I know some of you would like to revisit and have further discussion. And so we want to be able to make sure that that is an opportunity. The purpose, you know, the next step in this is that so that I can have a good, strong sense of where collectively we are in terms of recommending an in-person start date. Now, in the presentation, we had the timeline, and the timeline's based on averaging and projecting out the metrics in terms of cases per 100,000, the percent positivity. So those key pieces that we have been monitoring throughout this time. And I think what I am hearing from all of you is that we need to continue looking at those. We're not going to turn our back on those, but specifically what maybe range of percentage would be acceptable, how many cases of per 100,000 would be something that we can look at very closely. Is that less than 100 still, or are we giving the range? I think the COVID-like illnesses has already dropped to an acceptable level, but really the key piece in terms of the community spread piece would lie around, I'm hearing from all of you, those two metrics. Would that be a fair statement? And maybe we can turn, Sarah, I think we all wanted to look at that one slide again. So maybe Sean, if you could look at that, and we can have some further discussion around that.
Yes, sir. I'll go ahead and share it.
Because that slide is, you know, all along we want to be responsive to the current information, the current studies, the information that we hear from the medical professionals, both here in the state and at the national level with the CDC and that kind of a thing. And so I think it's important for us to continue to be somewhat flexible with that as we look at some of the metrics. And the only reason I am saying and offering a message of flexibility to some degree is because of the vaccination. And I'm fully aware that it's not an end all. It's part of the mitigation plan and strategy, and it will be emphasized. And if we can have a target date for which to plan for, we can, I think, well, I know we can have targeted, focused discussion with our students, with our staff in the planning and getting their input, that kind of a thing, but also with our families. And so anyway, this slide is up. So who wants to take it? Sarah.
All right, Member James.
Okay, so we talked about this a little bit in the study session. And this kind of relates to the slides that you have at the end of the presentation that show the metrics we shared with the community. They were metrics that we said we were going to adhere to. We have adjusted them, as was shown on the slides, based on the science that we've gathered and what we have listened, we've listened to the experts. That said, in August, as we've updated it, we've kind of made a contract with our families, whether they were families that wanted to go back in August or families that want to stay remote until they see metrics that they feel are going to be safe for their children and for the teachers. And so when we're comparing when we go back, I would love to see these slides, a slide like this, of any revisions of numbers we've done, because I don't think any of us would be comfortable with adjusting the metrics and having them be so too far off from the modified one we already have. I think these metrics are important. I think that being in the #1 COVID hotspot in the world is very different than being in other places, in other states, in other countries. And I think we have to keep in mind, I do think that community spread is in fact an issue, especially if we're talking about going back in a non-cohort way. We're not cohorting, we're going back 4 or 5 days. We're going to have classes that are more packed. And that said, if we're going to be successful, we're going to uphold our contract with our families and with our teachers. We want to ensure that when we go face-to-face, we are bringing in as many families as we can. Because I have a contract with Kyrene. I, as a parent, can't wait to see the metrics reflect what I agreed to in August when I said I'm in the flex program. I want my kids back in the classroom when it's safe. And I don't want any parents out there to feel that they cannot participate in our school district because we haven't upheld our commitment to safety and to the metrics. And I'm not saying we can't adjust them or give those percentage ranges like you're speaking about, Dr. Mandeville, but I think that we have to do it within the realm of responsibility and making sure that we are thinking about every single child. We have kids who want to be in person, need to be in person, and it's going to help their mental health. But we have kids that if they go back and if they feel like they have to go back because they can't do their AP class online, they're going to suffer. Their mental health will suffer. There's a lot of situations that we're not going to have a winning perfect answer. So we have to find the best answer. And maybe later when we can talk about some teacher issues, the asynchronous Wednesday, I'd like to chime in there. But if we could talk about the metrics and maybe creating, if we could see Mr. McDonald creating a slide like this for whatever criteria we decide on. And we all have to be able to sit with that. And we have to understand that the parents that have written in, have called in, have talked to us and said, thank you for following the metrics. These are vital to me and my family, that we can't throw those under the bus either. So that's what I would like to see as a follow-up.
Ms. James, thank you for that. I just wanted to comment that when we made this slide, this was an example of how we could move through. Never was it seen to be a contract in any way or a binding situation. What we did was looked at this and we were able to re-enter or reopen our schools. And that 2-day a week was really at that time what we thought would be the best. After going through that, we realized originally we would never get to below 25 cases to 100,000 at all this year, or maybe even as you continue to look at it, maybe even next year. And so that's why we kind of moved it to 50. Then you have lots of different opportunities with the Arizona Department of Health and Maricopa County. They have their benchmarks, of course, and that would be that top layer, which is below 100,000 cases before we could even go back. And then you have what I showed you today was the CDC as well, and their indicators that said, you know what, we probably should be in the range of 50 to below 200. And so I do think that it's going to be an important conversation, and I think your request is a vital one to say, where is it that we find ourselves? Because I think what we suggested that below 200 is more than likely to happen by the fourth quarter, but we all have to be settled in on feeling okay about that. Why I am okay about that is the components that we talked about today. So the mitigating behaviors, I think, are a big one. You heard the health professionals say the same thing. We're not going to get away from that. I do also think that the metrics being in a downhold, and again, like I've shared, when you look at this often over the year and be able to look at these on the daily, you kind of know which way these numbers are going to go a little bit and how the waves work. I'm not saying there won't be another wave. I bet there will be, and I suggest that we have about 9-10 weeks to play with that in that fourth quarter before the summer wave will probably hit. I do think with those two pieces, and then of course with the vaccination being the third component, it would be wise for us to bring our students back. But I'm more than willing to develop a a slide like this and see, present it to you all to see what you think.
Member
Thank
Hodge,
you.
you're on mute, Member Hodge.
Thank you. I do agree with Board Member James that we do need a slide on that information. I also would like to know more about the survey, because it really makes a difference of how our parents, we need to know how many of our parents want virtual, how many of our parents want online, because it changes how we position our classrooms. It changes how the learning is going to be, because if we have more kids virtual than on in person, how is that going to help our teachers to teach? I just think that we need that survey for our families to go out, because I really am curious to know how much percentage of our parents are looking at bringing their kids back into school at this time, and how many of our kids are going to go stay virtual. So I really believe that that is an important factor, that we can't make a full decision without having that information, because we really do need to know exactly how much percentage of our kids are going to be in those classrooms before we actually decide on scenario days and how many days we're going to do and how many out, because it really does to our mitigation on how many kids are going to be in each class. So I really would like to know that survey information as soon as possible, as soon as we can get it out to our families. Thank you.
Thank you, Member Hodge. Member Montero.
Yeah, I want to build off both what Member James and Hodge mentioned. I know Dr. Mendeville, I expressed to you that I think it's vitally important that we get student and parent input onto who would be comfortable going in person, staying virtual. And I think that also just for, so I don't forget, and for a future point down the road, is that, you know, we're still going to have a good portion of our families and students that are going to choose to stay virtual. And, you know, I don't want to lose sight of that. You know, while we put in the effort to make sure we're providing the in-person education as we move towards that, and as the metrics continue to go down, I don't want to lose sight of making sure that we continue to, you know, get a better educational experience for the students that do stay in a virtual manner. I don't want to leave those students behind. So I want to make sure that they're continuing to be in the conversation while we're continuing this. And moving on more to what Member James said about the metrics, I know you mentioned kind of, I think we need to discuss, you know, what that range is going to look like when we're going back, if we go back, coming out of spring break, because, you know, with the metrics we're seeing projected at the beginning of fourth quarter, you know, we're not going to be able to know what the effect of spring break is going to have. And, you know, if what we're going to see from the spike in spring break, is that going to bring us back into the red? You know, we need to have kind of a clear direction of where that's going to be and where we want to have that trigger to, if we have to go back in virtual, what is that going to look like? Because again, I mentioned this earlier, is I don't want to jump the gun to now where we have students that we, you know, are excited to get back in person, are adjusting to that, and now we're having to shift back to virtual because we made a decision too early. So, you know, it goes back to that idea of, you know, the disruption of education and what that would bring to our students. And even applying that to the health mitigation strategies. And I think these things are going to take time to get used to for staff and for students. I think, you know, sports was kind of case in point with that. So that these things are going to take time to get used to. So I think these are all things that we kind of have to take into account and when we decide what that range is going to look like for when we go back in person.
Mr. Montero, I will repeat what Dr. Mendeville said. I think we're running out of time. And I know I'm taking a stance here, but when you look at these metrics, I am assuming that most people could not predict out past the 8 weeks that we predicted out. Yes, we're going to have a little spike because of what we have seen in the holidays that we've seen in the past. But remember, these things have to be for 2 consecutive weeks. And though I think you'll see a blip of 1 week, I think we will return back to where we were pretty rapidly. And so I do appreciate those comments, but to have a prediction and not have a plan, or to wait, we won't go back to school this semester at all. And I think we better be prepared to make that decision at least that it is a point in time that we believe that we could go back and really look at that, because you're right, it's going to take time for our staff to come in and for our, those mitigating behaviors and the classrooms to be set up and all of those things. But I really am passionate in the fact that I believe this is the right time. But again, to predict outside of those 8-9 weeks, I don't think anybody has that. But I do think we'll have a small spike. Will that be 2 consecutive weeks? I don't believe it would be.
Thank you. Vice President Barraza.
Yes, thank you again for presentation, and the discussion's really beneficial. I think for me, looking at the big picture of just any scenario, any metrics we follow, I think it's incredibly important we keep asynchronous Wednesday, especially if we're looking at how we're going to be able to increase the achievement aspect of students in the classroom. There's a lot of makeup time to work on, and teachers and students need that time to work together in order to be able to clarify what path they need to overcome in order to be able to graduate, speaking for the seniors, and what other students have to do in order to be able to prepare themselves for the following year and make sure that the problem isn't compounded to the next year, as is always the case, you see with math. Where students are, consistently decreasing in their ability to be productive in their following math courses because there's still gaps. I think we're going to see more of those gaps, and so I think asynchronous Wednesday is essentially important for that relationship. I also I think it's important because we also have to make sure that students understand that they are responsible for their own achievement, and that they have to work towards these filling in these gaps. It's not something that we can look at and say, oh, so what, let's let it be. I think we really need to ensure that our credits are worth their weight in gold, and that the students don't have presented outcomes that are conflicting when they go to the next level education-wise, or trade schools, or career path, or whatever journey they may be going. So I think it's important we keep asynchronous no matter what scenario, and we work on focusing on that achievement, those achievement gaps, and filling in that. Primarily, we do it urgently in the fourth quarter, and so that's kind of where I stand in going back to school.
Thank you, Mr. Barraza. Member James.
Okay, yes, and I think that, Mr. O'Donnell, I fully agree that we need to have some sort of a goal in sight. And I think we all have the same goal of getting our kids into the classroom. That said, I think that we need to be very clear that, like you said, these are predictions. And we're hoping that, knowing that you did the, conservative take on these numbers, it would be amazing for our community to see a better outcome than what we have predicted, and to be able to see that it is realistic to go back after spring break. I do think that knowing there's a spike, and that was reiterated by Dr. Overland, that I'm wary of having that full return the Monday after spring break. And I think that looking for that spike and making sure that we're easing into in-person is going to be important. And I do also think that part of the parent survey needs to be, if we have a goal of returning after spring break, what is your comfort level with that? Would you be more comfortable giving a week of kind of leeway with those metrics? I think that there are a lot of parents, again, who are relying on us to follow metrics, and the metrics that they're going to see, if your predictions are close to accurate, the numbers that they see, the color that they see, the suggestion that they see are going to be those all in the red, virtual learning recommended. And we know you have updated numbers, and we're super fortunate and really grateful for that. And I think you've done a really excellent job of communicating that to the board, to admin, and to the community. So I fully trust your analysis of the numbers that you have that you can't quite show yet. But I also think that we have to understand that most of our community is looking at that dashboard and they're trusting what we have done for the past year. So I want to keep that in mind. And again, just remembering that we're making decisions for our entire school community, and it is a big district. We have students that have lost their activities, like my kids have lost their activities, but we have students that have lost multiple family members. We have communities that cannot quarantine their family members. They don't have the living spaces to do so. What are we going to do to ensure that they have an equitable mode of instruction? Because we have those students that are afraid to bring COVID to their multi-generational home or to their home that doesn't have multiple bathrooms. I don't think that we can say, watch the video. And I don't think we can say you don't have an asynchronous Wednesday to check in with your teacher. And again, then we look at it kind of compounds to the teachers. What are we asking of our teachers? Because we want to be able to tell them you don't have to teach in both modes. But I think that looking at what we're asking, I think that's what we are telling them. Like, that's my interpretation. And I'd like to hear thoughts on that, because that was one of the hardest things. The hard thing wasn't the 2 days a week cohorting. The hard thing was having half your kids in front of you or a fraction of your kids live in front of you and the rest online, and trying to figure that out. And I think a parent even pointed out, it was like sitting on your computer online in school. It wasn't in-person instruction. So there are a lot of things to kind of ease out here, but we need to be honest with the conversations we're having.
Mr. McDonald, you're on mute.
Yes, this is James. Thank you. Yeah, I'll ensure to you that I always, in my last 26 years here, I've always done what's best for kids, no matter what environment, marginalized or not. I was that. Just saying at this point, I will definitely get you the numbers that I believe are going to be viable. Even when you look at real-time numbers, here we are on February 3rd, and we're making predictions over 6 weeks. Those are the hard pieces. Real-time numbers or not, it's not going to give me what's happening necessarily in 6 weeks. And I do look at all of the zip codes, because all of those kids are important, as we said, 19 zip codes. I just think at this point, plan needs to be ready. Our teachers need to be prepared. Our community needs to know a timeline of a potential movement. And right now, I think the pros of going back to school outweigh the cons. And I think we heard that from our medical professionals. I think we heard that from our special speakers today as well. But I do hear you, and I want to be able to give to you and the board what is expected.
I appreciate that. I want to make sure that, again, like pros outweighing the cons, we have to make sure we're thinking again of all kids, because for kids that, again, it's not an exaggeration, have buried 6 family members or have had, the town of Guadalupe has been ravished by COVID. And they are a big part of our district. And we need to really take into account families that don't feel they have the option to go back in person, and that going back in person, that would actually put the burden of, on them as far as their mental health. And so again, we have to figure out, I would love to be able to figure out a creative way to get our kids in school, to get our teachers in the classroom, but also be cognizant of the fact that we do have students that cannot return, and that we need to provide the support and instruction for them, understanding that it is also a mental health issue. So it's difficult, but our district's huge, it's diverse, and thinking of every kid is our job. So I appreciate that you do that, Mr. McDonald. And I know, like, the fact that you take into account those 19 zip codes is incredible, and it's a huge service to all of our kids. So thank you.
I want to respond real quick, just a couple of things. And one is, I don't want there to be an assumption that, you know, we're not going to be mindful of a lot of these very important variables or aspects to consider for a safe return. And what I mean by that is that we're mindful, but the thing that I struggle with right now is that I need the assistance of or input from our parents. I need the input from our students so that we can better gauge some decisions and prioritize in that manner. So to Board Member Hodge and Montero with the survey, actually all of you have emphasized the need for a survey to gather some more information. And that's been part of the planning already, is to get that out as soon as we can and make sure that we're well targeted with the questions. You know, the questions with the surveys for the teachers that we gave earlier this week, you know, I have responses to that, and I will share that with the board. I'm encouraged by it, quite frankly, and I think with more additional information, because one of the key pieces to the questions that I received personally from teachers, and our teachers have been very respectful with their expressing their concerns, and for that I just commend them, because they're just truly you know, admirable and kind, but they're concerned and they just want some answers to their questions. And so here was one of the questions. Well, Dr. Mendeville, what are we going to do if, you know, we have a quarantine, as an example? Well, okay, like Chandler, like some of the other districts do, and it's like parallel instruction. And I talked to some of you about that, where we would have, because we spent a ton of money on the technology devices for the classrooms to have them you know, broadcast and take in and all of that. And so the teachers have those the mobile cameras, you know, they're sound and motion sensitive, so that they can the student, if our family members, some family members elect to stay home and have their kids stay home for whatever time being, you know, what, you know, could be the remainder of the fourth quarter, could be just a couple of weeks. I mean, you don't know until we ask, and that's what our intention is going to be. But then the student can directly look at and view and listen to the conversation with the students who may be there physically present. It isn't ideal. None of this is ideal in any way, shape, or form, but it certainly is a way in which our students can still stay focused on the content and the instruction of the teacher. There's a variety of ways that I have heard that can be handled. And to your point about asynchronous Wednesdays, if that day is truly targeted, it can be very targeted, specific to those students who may be electing to remain home virtually, to provide that additional support and clarification with instruction maybe from the previous day, the previous 2 days, kind of a thing. I just look at that as a win-win situation. What we have to do is survey our families to see how many would fall in that category, okay? And then we have about 800 students that are in Tempe Union Online exclusively, and those students would be factored out of their classrooms, because they are committed to the Tempe Union Online exclusive instructional virtual opportunity through the end of the semester. They're not permitted, because of the structure of the classes, to switch midstream in the mid-year. And so we'll have those 800 kids, plus we'll have the kids that elect. But we need to get some numbers, our hands on some numbers, so that we can then plan accordingly for the social distancing as best that we can, certainly within large congregating areas and spaces. But we don't know what we don't know, because we don't have more information. I also plan on utilizing our teachers to find solutions to some of these. I mean, I'm a prior teacher and educator and former principal and all that. I don't have all the answers though, but I know a tremendous talented group out there that could certainly help with finding solutions to starting. And if what I'm hearing, that 5 days is probably too much to at least go for, I can understand that. And then moving towards, you know, moving and maybe starting with 4 days a week with the asynchronous Wednesday is, I think, a very palatable compromise in light of metrics, that if there's a little bit of a wave after spring break, we can manage that better. If we have break two, and do that and just monitor that closely throughout this time. I also want to make it very, very clear to everybody is that we have always paid attention to the metrics, and we're going to continue to do that. This would be no different situation. We've been criticized for pivoting, but we also have been praised for pivoting based on what's going on in our community. And that's just what you have to do when you're facing something like this kind of a pandemic. But there's a lot of planning that needs to be done, but we need more information. If we have a target date, then we can plan accordingly with that. That being said, the health mitigation pieces is a huge piece to a return. Our teachers were very clear on that in one of the prior surveys, that, and naturally that would be something that they would want. And we're trying every measure and opportunity to get that in front of them so that they are vaccinated. And I'm fully aware it's not the end all. It's just part of our mitigation plan and strategies. So, combining all of that is what we need to agree upon. And I think we're getting there. Can we look at, after Member Hodge expresses her question? I'm not taking your role there, Mr. President Garcia. You're directing this, but because I wanted to address the range of percentage and start talking about that a little bit while we have what is going to be acceptable to all of us that we monitor and look at. Does that make sense? Said a lot.
Member Hodge?
Thank you. I'm not going to take a lot of time because we're at 9:30 and we've been on this call since 5 o'clock. And I know parents and people in our community are watching. So all I'm going to say is I agree with everything is being said. I want to make sure that when we start looking at options, that we also look at the fact that I know everybody's talking about asynchronous on Wednesday, but it's not just for virtual or online. It's for kids who need, we're talking about recovery. This may be that recovery day that we can give them to catch up, because grades are falling regardless if they're in person or virtual. We still need to catch them up. And I think that's a part of what we need to look at too. And that should be part of our survey. So I'm going to stop talking so we can get to the next part, because we really need to get these people off of this call, because it is going on 5 hours.
All right, thank you so much, Member Hodge. And then I'll put in my thoughts in this too. I agree with what folks have been saying with keeping asynchronous. I think just like Member Hodge, James and Montero and Barraza have said that, this truly is a beneficial day for a ton of people, both families, staff, and students, and more importantly, students. Folks that say, why do we have an asynchronous day? And, well, also it's because we're also in a pandemic. And Member Montero and I got to talk with a handful of students, and they even, asked us to prioritize asynchronous days because they use it as a mental health day. And I think it's also important to note that Senator Bowie in the state Senate also introduced a bill that would allow students to use or not attend school and use a mental health day as an excused absence, and that passed unanimously and is making its way through the legislature. So I think it resonates that that's a need, and it's important for not only our students but our staff and cleaning and also keeping up and using it again as that is important as we go. The other piece with respect to timeline, excuse me, I'm looking at the dates for the pods where we've collaborated with other school districts. And, I want to thank everyone who had a hand in that, because that was certainly one of my priorities, is to get as many folks access to that and pushing that. But when I'm looking at the timeline for, especially the folks who've only got their first dose with Chandler, that timeline for January 30th and 31st, that they won't even have their second dose. I'm not sure when that is expected, or if they can use it in the or what that timeline looks like for that. And then in addition to our own pod that we have for the 19th and 20th, that well goes into the fourth quarter. But then again, we also have staff that have gotten their second dose and will be within the 2-week post second dose that will be covered in this after spring break. So my question is, how do we best balance to make sure that everyone is still considered safe within those timelines, but also still providing in-person instruction and assessing the extent of vulnerabilities for everyone involved?
President Garcia, I'd like to answer a little bit to that. Both the Phoenix Union and the Chandler Unified are going to be able to utilize the February 26th and 27th dates of the Phoenix Union one. So our Tempe people, because of the 28 days that it takes for Moderna to do, they're able to do both of those. So we could have second doses for both of those groups. The one that we won't have is if they're just going to participate in the one on February 19th and the 20th, will be into March, 4 weeks after that. But all the rest of them ahead of time should have their second dose, and then 2 weeks later be able to fall into just before fourth quarter starts.
Yeah, and I want to remind folks too that I'm pleased with our percentages, but we need to do better than this. And so individuals have a variety of reasons why they may choose at this time not to be vaccinated. I think you saw some of the numbers of waiting. Some are waiting. Some are going to do it during the summer, or some are just never going to do it. So everyone has a variety of reasons, but I just encourage everybody to look at this as another way that we can provide some level of safety measures in place along with our health mitigation plan. It's advantageous to get the shot, and the dose. So, we highly encourage that. The other piece is that we are making an assumption, and I think we need to be optimistic with new administration direction and the possibility of receiving vaccination doses to our pharmacies. And so I truly believe that there will be other opportunities that will be presented to us, pretty soon, hopefully, as a high priority, because I know that with this current administration that getting our this 1B workforce is extremely high on his team's priority, as it should be, because we all have agreed repeatedly that we want our students and our staff back on campus in person, because that's when they perform and do their best. So what else is going to say? Okay.
All right, so at this time, what we're going to do is we'll have Member James, Member Montero, and I see Mr. McDonald raise his hand too. And then after that, Dr. Mendeville, if you can give us kind of a summary, and also what left do you need for us to discuss? And while I recognize that this is a long meeting, it's also an important one. So I want to make sure that while we're still being cognizant of everyone's time, that we still get the important pieces together. So that way we have something to move on to. Thank you. So Member James.
Thank you, President Garcia. So I'm looking at this timeline, and again, I do think it's good to have goals. I do think that we need to be very clear about what we're going to be looking at to decide that goal is achievable. And again, discussing more of an easing in and a return. I'd also like to look at that 2-week requirement for teachers, and I'd like to get feedback from the teachers about that, because what I've heard is it was a big problem for some teachers. It wasn't seen as necessary, and maybe the second time around they've already gone in and prepped their classrooms once, they've already prepped their students once. So if we could look at getting a lot of teacher feedback and maybe talking with the association, if they can put a survey out, get a temperature check from their teachers as well. And maybe, if we're having these conversations, inviting a TSEA exec board member to these conversations so we can maybe have them on site as reference would be really helpful in the future. I'm also looking at the vaccination schedule and thinking about the teachers that maybe cannot receive the vaccine for whatever reason. Their doctor, you know, they're immunocompromised, their doctor doesn't want them to get it at this point. What accommodations we're going to look at making for them, because we don't want to lose teachers. We need to be attracting teachers, and teachers that maybe live with immunocompromised family members. This is a pandemic. We've never lived through this before, and being flexible with our work staff and looking at the human side of this is going to be vital in retention. And again, when we go back, that we do it in such a way that we stay back. We have in-person graduation, and we do not need to, you know, we hear a lot about why are these districts doing this and we're not. Why can Chandler do this? Why can Mesa do this? Those districts are suffering from going fully in person to hybrid to fully remote, back and forth. And I know Board Member Montero mentioned that we know 22 years of education, one of the most important things I can provide my students is consistency. And so we do not need our schools and our classrooms to be that bouncing back and forth between different modes of learning. And it might happen once or twice, but I mean, I have friends in these districts that are either on leave, have resigned, aren't coming back, or feel stuck. And the last thing I want is for our teachers to feel stuck. I have teachers who are supposed to be in hybrid when their school goes 2% positivity rate, and they're at 2.67 with no solution in sight. It's like, it's not happening. We cannot do that. We see it all over. Our teachers see it, they observe it. And when we receive letters that say, thank you for being a safe district, we need to really respect that and continue it. And I have faith that we will. So yeah, I just really want to look at that timeline in a way that we're not bouncing back and forth, and we're really being responsive to teachers. And then we need to have a robust conversation about instruction, because the teachers are they're not just going to teach the in-person kids and hope that the kids at home follow along. Our teachers are going to try to make sure every kid gets the instruction they need, and we need to help accommodate that. So that's a future conversation, I think. But yes, I would definitely like to know what accommodations our educators are going to be having when it comes to vaccine and modes of instruction, and ensuring that we're not bouncing back and forth and giving our students and staff whiplash. So.
Thank you so much, Member James. Member Montero.
Yeah, I really quickly just want to circle back to something President Garcia mentioned, you know, with the asynchronous day and the focus on mental health. And I first want to preface this with, you know, coming to this discussion, you know, I currently a student at ASU. I have not stepped foot in the classroom since March, and I've gone through virtual learning myself for almost a year now. So, you know, I feel like, you know, I have an understanding of kind of what students are going through, especially when it comes from the mental health aspect. And I want to put this on your radar, Dr. Mendeville, and we're talking about going back in person, because I think this is vitally important, that as we're considering going back in person, I think now more than ever is when we need to make sure that we have the resources. You know, they're going to get convoluted in the process of returning to back in person. And that's one of the things that a lot of the students expressed to President Garcia and I is, you know, that they don't know where to seek those resources. And we've got freshmen who are going to be entering on campus for their first time. And you know, students are now more than ever going to need that support. You know, we have students that have quite frankly been traumatized and have lost family members. And so I think just making sure that that is also a priority of where we're shifting that and how we're making those resources visible as we're returning to in-person. I just want to kind of make sure that that discussion is being had and put that on your radar.
Thank you, Board Member Montero, because that's precisely one of the charging forces to get kids back to school, so that we can, when we see them, we can hug them. We can, well, maybe a virtual hug or an elbow, but we can actually make the contact and identify the student and put them in front of a caring adult rather than in a screen. So yeah, you're absolutely correct and right on target, because I know that's one of the things that some of our counselors have said. If we can just get them here, we can help them. Care 7 folks, our dropout prevention court, any of those support systems and those teams, if they can just get them to school, even, once, then you can hook them in and they're going to want to remain and be focused. So you're absolutely correct. And that is part of the layered plan of support that we want to have. Again, a survey with our counselors and support system teams will help in navigating what kind of measures we need to have in place for the first day. And I'm fully aware too that I have lofty thinking of win-win and all that and having our kids back. I'm just anxious because I know that they're anxious, but they're also anxious for a lot of reasons. They want to be at school, they want to be at home, they're worried about auntie, they're worried about, and so it's trying to make that balanced decision. And I believe we can do that. We have a lot of very intelligent, caring individuals in this district, and there's no reason why we can't figure that out. And I think that with some of the information that I'm hearing from you, I think we're shying away from a 5-day start right off the back. So I think that's pretty clear. But certainly looking, I think, at a 4-day with asynchronous Wednesdays. And if we did the 4-day, we can target that, but also a lot of that is going to be based on the metrics at hand in the prior weeks. And so there's that pivot I keep talking to you about, that we will be prepared to respond one way or the other. And so Dr. McDonald, soon to be Dr. McDonald, will be working on those metrics with ASU and other folks who have far more information than I do at my fingertips. But that is the piece. The other piece is that we can feed our kids, because I'm concerned about that. For many of our students, they can their breakfast and their lunch is likely their only meal for the day. And so I just look at my head in that way, and I'm thinking, how are we going to really help all of our kids, to your point, Member James, because we are looking at the whole group of our students, and we're such a vast district in terms of size, and we draw so many kids in that we're trying to make the best decision. So I think I have that. I think that we need to still revisit, and maybe that's a different time that we revisit the percent range, Mr. McDonald, because I look there and that's still unclear to me. So I need to have that clarity. So can you go to that one page, the CDC one where you have the arrows going down?
Yes, but may I say something before we leave this piece? So I just want to say to Mr. Montero that we're already working on social emotional transition plan for our kids. We know that our kids have essentially been out of school for over a year, except for 3 weeks, and we need to get them back to transitioning to what is normal. The other part is I spent all of my administrative career in Tempe High, Padre, and Marcos Deniz, and know those communities extremely well. I also know how at risk those communities can be if we don't get them back. We may never get them back. And so to Mrs. James, I hear you. And on both ends, we have arguments on both sides. So I totally agree with you. The reality is what I gave you today is the best case scenario of getting kids back with the mitigating behaviors and the safety, so that we can have some sort of normality for our kids, so that we can impact them, their diversity, equity, and inclusion, the social emotional wellness, their safety and security that they presently do not have right now. So I'm with all of you. I think the 4 days a week with the asynchronous day is a fantastic idea as well. I just want to make sure that we don't lose the opportunity because we're not prepared. And that's all I'm saying is that probably is a really good preparation day. Equally important is going to be the transition for our teachers. They also have not been in the classroom since, many of them, except for 3 weeks and what will be a year after spring break. And we need to help support them as well. Which one do you want to go? Do you want to go to the CDC link?
Yeah.
Yeah.
Is that the one, Member James?
So the reason why I showed you these two pieces, this being the Arizona Department benchmarks, they will say the original benchmark was below 100 per 100,000, below 10%, below 10%. What the CDC has recommended, and this is probably what you hear a lot of people talking about as well, they're looking at this range of somewhere between 50 to below 200. And so we could look at that, and that's what I looked at as a very conservative number when we looked at the numbers at what would be the 9th week or just before the 4th quarter would start. That when you look at those, we'd probably be in the orange. We'd probably be still in the red with percent positivity. You heard Dr. Woodbury talk about when numbers go down in testing, those numbers are going to stay up. We know that the 100 per 100,000 will go down. We know that the hospitals will go down. We also know the state's going to look at us and say, hey, you got one yellow, go back to hybrid. That's all about a recommendation. So we just need to be prepared to have the conversation. When you look at the rest of the indicators, gold star, in the moderate range, gold star. And that's where I was looking to say, hey, we have opportunities here. We may not hit every indicator in the moderate range, but if we get the majority of them in there, I think we have a space and time before the next wave starts, probably in June, that we can get our kids reacclimated, catch them up, graduate them. We're already working on a graduation plan. And then hopefully have a decent summer that we can get by and start right back in August again. And so that's where I was coming from on that. But definitely thinking about all the diversity and all of the kiddos that I've loved over the years. But I'm also knowing that working at Kapati for 7 years, once we lose them for a longer period of time and they go out to the workforce or have other opportunities, we may never see them. And that would be part of what we would be remiss about.
Yes. So as we move forward, because I totally understand all the different arguments and conversations that are going on. I also want to be cognizant of, again, our time and as we move forward with this. One of the other things that I wanted to bring up is that as we go back in person to have families and students signed a COVID code of conduct, that these are expectations that we are going to be enforcing, and there will be consequences if these aren't abided by. And this came from a community member suggestion, and I think this is one of the clear ones that we need to be following, because that way we can also reinforce the mitigation strategies that are in place. With respect to our losing some of our students to the workforce, some of them, we need to figure out ways to support them as well, because they, a good handful that I know have left because their family members got sick or passed away, and now they have no other means beyond getting to the workforce. So just a few points there. Dr. Mendeville, so we can start wrapping this up. What explicit things do you need from us in order to move forward? That way we are able to have something concrete. And if we don't, we can have at least some pieces that are figured out so we're able to communicate to our staff and community.
Thank you, President Garcia and members of the board. So yes, what I have here is that we're going to be looking at the metrics, continuing to look at the metrics. I still want to make sure that are we saying 100 to 200 is going to be an acceptable range that kind of parallels the CDC guidelines, or are we, if we go back to less than 100, we'll never get back to school. And so those are the realities that we're trying to balance, that if we can't, so I think what I'm hearing is that we're going to be flexible with that piece, mindful of the metrics that are going on in the weeks prior before we even shoot for a date. The goal is to get, I'm having a target date of March 15th right now, this very second. So with that, I think we can backwards design through input we get from surveys for our students and for our teachers And Board Member Monteto, I may ask you to help me with appropriate survey questions for our students too, because you've had some contact with them recently, and President Garcia, to maybe, navigate some of those questions so we get the right kinds of responses. But then our teachers and our families to get more information so we can plan accordingly. I do want, Board Member James, in your comment about, the instructional delivery model and how if there is some semblance of virtual left, whether it's, hybrid or the student is viewing and listening, what does that really look like for the teachers? So I want to have our team start looking at that, with camera positioning. What's the reality of that? Is the data and assignments in Schoology going to be appropriate for that day? If we are agreeing on the 4-day a week with the Wednesday asynchronous, what purposeful support are we going to have for students for making up work, for doing assignments, all of those things, but also the social emotional elements that are very real for our students that should be going on every day should that be necessary. I think I have enough to work with right now. I think we're saying 4 days a week. I think I need more information from survey input, President Garcia. I know that the health mitigation plan needs to be emphasized with our employee base, all of our employee base. That's going to take some transition back into the schools. I'd like to get input from our teachers to see what is it they're going to need so that they're fully aware and equipped of and reminded of the health mitigation plan, because they've been out of the picture for a while. So we're going to need to retrain and acquaint everyone with the health mitigation plan. The COVID code of conduct, President Garcia, we actually have I don't know what we call it, Sean, an agreement, but it's when our in-person high priority students were coming in for support, they signed that document, which is like the equivalent of what you're suggesting, President Garcia. So we have something in place to go with that. I think that piece is also an element, because I have heard from our community members that we will do our part to ensure that students are, masked, and that and so I'm going to rely on those words and their assistance, because together we can make this happen, but it's got to be together and responsibly. I think I have enough to work with, President Garcia, with this.
Great. All right. So, and just to kind of recap, that the recommended action is that the governing board take the criteria for returning to in-person instruction and, based on the governing board's November 18, 2020 resolution, discuss with the superintendent the use of such criteria in his determination of when and how in-person learning may resume. As always, board members, if you have additional questions, please, send those over. I'm sure this is not the end of the discussion, but certainly a continuing one as we adjust to find a flexible, balanced approach to make sure all parties and more importantly, our students have what they need to move on. So having said that, are we on an agreement that we continue to the next item on the agenda?
Yes, as long as I'd just like to ask a favor of Dr. Mendenville that you get that information in the model presented to the board before the next board meeting. We have only one meeting before March, and if we're looking at March 15th, I don't think we can have any confusion among our community members, among our staff members. I think we need this now. I'm sorry to put that type of pressure on it. I know it's a lot of work, but I just think there's a lot to consider. So if you would just keep us in the loop as much as you can.
Soon to be Dr. McDonald will, I'm sure, will be working on that tomorrow.
Thank you, guys. And again, I'm sorry. I'm just thinking, March is so close. And
oh, you're absolutely correct.
I appreciate it.
I agree with Board Member Vice President Barraza that we definitely need it as soon as possible to make decisions.
Yes. And if needed, we can reconvene as a board and move forward to continue that in the most expeditious way possible. Also, I'd like to remind folks that I do appreciate the district's communications to our families. I went back before this meeting and looked at how many family letters have been sent out. I believe it's over 35. And so, keeping up to pace and, adjusting as needed throughout this pandemic is certainly challenging. And I know that is something that we prioritize in communicating to everyone involved. Granted, there's always room for improvement, but I think acknowledgement is due, especially when there's so many moving parts at a time. So, all right, having said that, we will move to our final item of the night, communications from governing board members. I will begin with member James.
Thank you. I think we've had a ton of communication, but I do want to acknowledge, as we celebrated earlier, that it is Black History Month, and I'm excited to see Tempe Union continually dedicate itself to anti-racist work. One of the things that struck me was reading a quote that said, just imagine that if your history was celebrated in the course of 1 month or as an extracurricular course. And as someone whose history has always been mainstreamed, it really struck me, and I think that dedicating ourselves to that work and to ensuring that all our kids are represented in our curriculum robustly is important, and I'm excited to see that continue and in a very open and transparent way in the district. So happy Black History Month, and let's keep it going past February 28th.
Thank you so much, member James. Member Montero.
Thank you. And I first want to thank all the community members that have, tuned in this long and also submitted public comment. I know it was only 1 minute, but I want you to know that I know I can speak for my other board members that we do take the time to read what you send us, and we take that into account for these conversations. So continue to send in your emails and your public comment. We always love to hear from the community. And I also want to, I know we mentioned earlier, but I want to congratulate our Flynn Scholar finalists. We had Maya and Tyler from Tempe High, Mitch from Mountain Point, and Shirley from Desert Vista. So congratulations to all of you. And then I also want to thank everyone who put the work in behind in partnering with Phoenix Union and Chandler to help get our staff vaccinated. So that's all I have.
Thank you so much, Member Montero. Member Hodge. Sorry, it's getting late.
Yes, it is. And remember, James took my quote. You got to realize something. You don't go on the quotes. That's Perdetta's thing. Okay, so my quote of the day is, you must never be fearful about what you are doing when it's right. And that's by Rosa Parks. And that starts off with Black History. What I wanted to say about Black History Month, after being an African American and being in that corner for my entire life, is Black history is history. So it's not just 1 month. And we got the lowest month, the least amount of month in the year, which was always going to be something that troubles me, but it is history. So it is not no such thing as just Black History Month. I also wanted to thank the Flynn semifinalists of all the schools. Also want to congratulate our kids, our students who did the PSAT. We had 1 student from Compadre. We had 215 from Corona, 313 from Desert Vista, 57 from Marcos, 47 from McClintock, 81 from Mountain Point, and 69 from Tempe High. So, and we did it in a pandemic virtually. So I want to give congratulations to that. Also want to give congratulations to, we had a winner, Miss WC, which was my teacher at Tempe High School for orchestra. She won the George C. Wilson Leadership Service Award. Congratulations, Miss WC. Last but not least, I've been meeting with individual people in our community to get them to be mentors. I have met with our Chief Glover from Tempe Police, and he's going to actually be a mentor at our schools. And he actually took a tour of Mountain Point. I also have Mayor Corey Woods is coming to our schools in the next couple of weeks with me to do a tour of our schools and be a mentor. Also have Mr. Jevin Hodge, who's going to be a mentor to our kids. Our African American kids have they're one of the ones that have the least amount of mentors in our Native American kids. So we really do need to get mentors out there for them. And I want to thank them for those 3 for come in and putting their name in it. And also to our esteemed mayor of Phoenix, Mayor Gallego, who will be doing a tour with me too. So that's it. Thank you.
Thank you so much, Member Hodge. Vice President Barraza.
Yes, I'd just like to again thank the staff for all their hard work for the past year during this entire pandemic. It's very much something that, you know, people don't realize. It's very unspoken. So I'd like to thank all our staff members for, you know, such a hard year. And, you know, I really hope that we can move forward here as soon as possible. Other than that, I would just like to thank also Kelly Gardner. She's our webmaster, webmaster digital media coordinator. She provides us with some stories, you know, about each campus and the highlights of what students and staff are doing. So I'd like to thank her for that effort. I'd also like to thank Warren Cole for all the hard work and the video. Well, for tonight's meeting, for one, and all of the videos that highlight what our students and staff are doing throughout the year. I think it's really great, refreshing, and it's a great tool that helps generate more recruitment for students and families to understand what we're doing here. I think it's a very, very good work, and often, you know, the guy behind the camera doesn't get a lot of credit. So thank you, Warren. I appreciate that.
Thank you so much, Vice President Barraza. Also, you know, you all took most of my comments. I see what you mean, Member Hodge, that everything gets taken by the time it's your turn. But I also want to echo what Member Hodge and James said with respect to Black History Month. You know, happy Black History Month. But again, it's something that is ongoing and throughout the entire year, not just during this month. I also want to congratulate our Flint Scholar finalists. And really excited for the 4: Maya Steinberg from Tempe, Shirley Wang from Desert Vista, Tyler Wright from Tempe, and Mitch from Mountain Point. So it's a very, very competitive scholarship with over 1,000 high school student or seniors applying. And the fact that, you know, the 4 of you and previously the 6 as semifinalists, but the 4, especially as finalists, is definitely an achievement. So congratulations to you all. We're definitely proud of you. Also, I want to thank Mr. Kranza and Ms. Muhlmans for all of their work to help get us to AAA bond ratings. This is the first time that Tempe Union has ever gotten AAA bond ratings, and it's a testament to their work and all of our partners that we work in collaboration with. A very, very, very few selective school districts get this recognition, so thank you all. Also, thank you to the community members for writing in. Like Member Montero said, please keep sending them in. Please share your thoughts, and you know, even if it means, you know, just one of us, if you feel uncomfortable sharing with all of us. And then finally, you know, thank you to our board. Our job is incredibly difficult. It is unpaid, and oftentimes, you know, a second, third time job. So thank you all so much for your dedication in this work as we do what's best for our students, staff, and community. With that, I move to adjourn this meeting. May I have a second?
President Garcia, I second.
Thank you so much, Vice President Barraza. All those in favor say aye.
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 Aye. Any opposed? Motion passes 5-0. Thank you, everyone. The